sáré kan máa bà wá bú wọn sẹ́ àwa náà sáré pé kọ́ta ọmọ fákòwà jẹ́ ọkọ̀ bọ́sẹ̀.
ọ̀tá ń sáré kan padà wá bú wa.
ọkọ̀ bọ́sẹ̀.
àwa náà sáré pé kọ́ta.
ó yáná ṣùgbọ́n àkìyàn ọjọ́ yẹn mà rí o my brother. àkì tí wọ́n ti rò pé kí ni kò lè bá wọn lé ọmọ o.
Mike check. Check. Aji, be careful. Check. Mike check. Mike check. Check. Mike check. Mike check. Out. Mike check. Good. Good. Check. Check.
Ọlọ́láyé mo bá ròdé tiwa ni ọlọ́láyé lónìí tèmi ò ṣe nọ́mbà 1 wáléyé mo bá ròdé hò tí mo àti àwọn kì í sọ́mọ́ mi ní tòsí ìpolówó wọ́n sáré kan bá padà sọ̀rọ̀ ìròyìn wọ́n sáré kan lè lọ síwájú ilé ayé gbogbo wa la sáré àti làákì ṣùgbọ́n síwájú
wọ́n sáré kan bá padà sẹ́yìn ìròyìn àwọn yẹn sáré kan lè lọ síwájú ilé ayé.
Akiri gbogbo wa la sáré àti làákì. Akiri ló ní tàbálà ká má gbàgbé o tàbálà ká má gbàgbé o Akiri pàgbára kọ́ kì í ṣe mímọ́ ṣe wa pàgbára kọ́ kì í ṣe mímọ́ ṣe wa torí ẹni tí ò làwọn kì í ṣọ̀lẹ o ṣe bọ́lẹ̀ lásìkò tán lọ́hùn ún lọ́fun wọ́n sáré kan bá wíwá gbé ìròyìn àwọn ẹ̀ sáré kan lè lọ síwájú ilé ayé gbogbo alásáré àti làṣẹ.
aṣíwájú wọ́n sáré kan bá padà sẹ́yìn ìròyìn àwọn ẹ̀ sáré kan lè lọ síwájú ilé ayé gbogbo alásáré àti làṣẹ.
ìwà ìyé ló ní tèmi tiwa ni àwọn ẹ̀gbọ́n tèmi láti ilé ṣàníbọ́lọ́hún dúró ọmọ CAC ẹ̀gbọ́n yóò mọ̀ bá ròdé tiwa ni ní ní owó sẹ́ ní ní ọlá ìwà ìgbé
ọ̀dára ni o.
ìwà ẹni tó ń jí lówùúrọ̀ tó ṣiṣẹ́ irú wọn ló jáde oṣù wo ìwà ìgbé múra ṣiṣẹ́ ọ̀rẹ́ mi
iṣẹ́ la fi dẹnu gíga.
múra ṣiṣẹ́ ọ̀rẹ́ mi
iṣẹ́ la fi dẹnu gíga.
múra ṣiṣẹ́.
iṣẹ́ la fi dẹnu gíga.
ó yá ní ìwà ìgbé ìwòsùn òbí mo ní o máa tẹ̀ lẹ́nu.
kúdúkúdú méje kúdúkúdú méje méje yá 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 má tẹ̀ lẹ́nu.
ìwòsùn òbí mo ní o máa tẹ̀ lẹ́nu díwáì ẹni tó tẹ̀ lẹ́nu ẹ fún wọn ní ìgbádùn ó tó sọdún tó sọdún. ìwà ìgbé máa ń tọ́jú ẹ̀ Ismail Gold wọ́n ti kọ́ níwájú mi lónìí ni máa wí bẹ́ẹ̀ ìwòsùn òbí mo ní o máa tẹ̀ lẹ́nu Ismail Gold àwọn tó tẹ̀ lẹ́nu ẹ fún wọn ní ìgbádùn ó tó sọdún tó sọdún. Orí kò yà sọ fún wọn ọ̀rà kóra ní ìyanu ó tó sọdún tó sọdún. Ó yá ní ìwà ìgbà kan ni wọ́n. Díwà mi bàbá, mo sùn òbí mo ní o máa tẹ̀ lẹ́nu. Àwọn tó tẹ̀ lẹ́nu, ẹ fún wọn ní ìgbádùn. Bámbé mi bọ̀bọ̀, ọlọ́lá ti wá ní bámbé mi o. Ẹ̀gbọ́n mi díwà yìí, ẹ̀gbọ́n tèmi nìkan tuntun ni, ọmọ CAC ni, ó ní kí n wí pé ẹ fún pé náà kíkan, kí ló wí náà?
ìgbé ìrẹ̀lẹ̀.
Àwọn tí CAC bọ́lá ń dúró rè o.
ojú dákẹ́ ìdájọ́.
Àwọn ẹ̀gbọ́n yé mo bá lòdì.
tí gbogbo ẹ̀dá.
Díwà yìí ọdún dé díwà gold.
ọdún ìjà sílẹ̀ tí
Díwà gold ti wá ní.
ẹlẹ́ṣẹ̀ padà.
Bámi tọ́jú Ismail mi bọ̀bọ̀.
ọdún ìjà sílẹ̀.
Àdùnkù mi bọ̀bọ̀ oṣé.
ẹlẹ́ṣẹ̀ padà.
Ó yá gbọ́ àdùnkù lèyàn wa.
èèyàn wa
Lèyàn wa.
èèyàn wa
Lèyàn wa.
èèyàn wa
Àrẹ̀gbé.
èèyàn wa
Àrẹ̀gbé.
èèyàn wa.
lè ṣu kí lè ṣu pẹ́sẹ̀. akérògùn òòṣà akérògùn òòṣà lóyún wa bàbá 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 wa akérògùn òòṣà ẹ kò wí pé akérògùn akérògùn àtúnṣe àtúnṣe wọn akérògùn bàǹtí bá jẹ́ mi rókù bàǹtí mi bá jẹ́ mi rókù ẹ bá mi tọ́jú bàǹtí bá jẹ́ mi rókù tiwa ni àwọn tí ààrẹ góòdì gangan ni àti ìlú ṣe nọ́mbà wán àti ìlú ṣe nọ́mbà wán ó yá wípé ààrẹ ti dé owó ti dé. ẹ bá mi gbé fájẹ́mi rógùn kò súnmọ́ mi nítòsí fájẹ́mi rógùn ti wá ní o ẹ bá mi kò súnmọ́ mi nítòsí olówó complex fájẹ́mi rógùn ẹ sọ bẹ́ẹ̀ ààrẹ ti dé o owó ti dé túndé ààrẹ gbẹ owó ti dé àjàmàlà bàbá mi ní owó ti dé aláfẹ́rẹ́ bàbá tèmi nìkan owó ti dé ẹ̀jẹ̀ fún wọn láyè wọn fẹ́ wá sórí stéèjì owó ti dé báńkì olówó complex owó ti dé ẹ bọ́lẹ̀ lórí stéèjì ẹjọ́ náà owó ti dé ọlọ́láyé mo bá ròdé ó ti wá ní owó ti dé túndé mi àrẹ́gbẹ́ báńkì owó ti dé báńkì olówó complex owó ti dé olówó complex báńkì ti wá ní owó ti dé ó tún fowó ní láṣẹ mi lọ́wọ́ lẹ́nu owó ti dé báńkì yé mo bá ròdé ó ti wá ní ó yá báńkì mo ránu gbà lábẹ́ igi àánú. olówó complex láti tọ́jú aláfẹ́rẹ́ máa jí fájẹ́mi rògùn mo ní mo ránu gbà lábẹ́ igi àánú àjàmọ̀lá mo ránu gbà sẹ́ lábẹ́ igi àánú ìbànújẹ́ ti kẹ́rù rẹ̀ máa ń jí ó ti sá lọ ìbànújẹ́ ti kẹ́rù rẹ̀ sẹ́ ó ti sá lọ àjàmọ̀lá àwọn máa ń jí tiwa rẹ̀ ó ti sá lọ bámi tọ́jú aláfẹ́rẹ́ àwọn máa ń jí ó ti sá lọ àwọn máa ń jí dandan ní gbogbo wa ó ti sá lọ túndé mi àrẹ́gbẹ́ rè túndé àrẹ́gbẹ́ bá mi tọ́jú bfk rí bá mi tọ́jú àjàmọ̀lá bá mi tọ́jú báńkì olówó complex wa ni ìdí nìyẹn ni wọ́n tó máa yọ ìbànújẹ́ sí lọ́rọ̀ gbogbo báńkì bá mi tọ́jú tó ní oyè tọ́lá ọlọ́lá mo bá ròde bfk àwọn tí apc ìjọba federal bí ẹ pé mo bá ròde o ẹ jẹ́ kó máa bọ̀ lókè bámi tọ́jú bí ẹ pé túndé mi bọ̀bọ̀ mo bá ròde o ọ̀rọ̀ rẹ ti dìde ọ̀rọ̀ rẹ ti dayọ̀ bí ẹ pé yẹlẹ ní tèmi tímọ́tímọ́ bá ń jí tiwa ni ọ̀rọ̀ rẹ ti dìde sẹ́ ọ̀rọ̀ rẹ ti dayọ̀ ọ̀rọ̀ rẹ ti di ọ̀rọ̀ rẹ ti dayọ̀. ẹ̀jú ẹni tí ò bá náwó kó máa bọ́lẹ̀ lórí stéèjì. ọ̀rọ̀ rẹ ti dayọ̀. ọ̀rọ̀ rẹ ti di jbsk. ọ̀rọ̀ rẹ ti dayọ̀. èèyàn tó yé tán láti wá ní. ọ̀rọ̀ rẹ ti dayọ̀. owó yé tán lá ló ń ná mi lọ́wọ́lọ́wọ́. ọ̀rọ̀ rẹ ti dayọ̀. ó yá bfk ìjọba. 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 ìjọba federal. ìjọba. 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 àjàmàlà. ìjọba. 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 bàbá wa. bàbá wa. bàbá wa. bàbá wa. bàjí. bàbá wa. aláfẹ́rẹ́. bàbá wa. bàbá wa. bàbá wa. bàbá wa. bàbá wa. bàbá wa. aláfẹ́rẹ́ sọ́dún mọ́ ẹ o. ó dùn mọ́ mi o. ààrẹ dé tiwa ni. ó dùn mọ́ mi o. aláfẹ́rẹ́ yé mo bá ròde. ó dùn mọ́ mi o. aláfẹ́rẹ́ yé mo bá ròde tiwa ni. ó dùn mọ́ mi o. bámi tọ́jú àjàmàlà tiwa ni. ó dùn mọ́ mi o. bájí olówó complex. ó dùn mọ́ mi o. gbogbo complex yóò ní wo lágbára ọlọ́run ọba. ó dùn mọ́ mi o. ó dùn mọ́ mi o. ó dùn mọ́ mi o. gbàmọ̀gbàmọ̀ yé ló ní tèmi. ó dùn mọ́ mi o. pẹ́ẹ́rán tiwa ni. ó dùn mọ́ mi o. bfk àwọn ti sọ mímí michael ẹ máa bá mi tọ́jú ààrẹ gold àti ìlú ṣe nọ́mbà 1 ààrẹ gold àti ìlú ṣe tiwa ní ó yá nítorí ààrẹ yé mo bàdòdò ó yá ná ìbọn lòṣù yé ìbọn lòṣù kí lòṣù fẹ́ ṣe ẹ sọ bẹ́ẹ̀ ìbọn lòṣù yé ìbọn lòṣù kí lòṣù fẹ́ ṣe ìbọn lòṣù kí ló wí. àtàmọ̀lá lélẹ́yìí máa tọ́jú bẹ́ẹ̀rán ó ní pé ìbọn lòṣù kí lè ẹkú ìmúra bẹ́ẹ̀dẹ̀ tí mo ti máa wá ṣeré àjàmọ̀lá kí lòṣù fẹ́ ṣe. ó yá àjàmọ̀lá ló tún ní kí wípé orí tí o mú wáyé orí owó ni. bfk orí tí o mú wáyé orí ọ̀la ni. àrẹ̀dẹ̀ orí tó mú wáyé orí owó ni. bfk àgbọ̀lómi nínú kò sẹ́ni tó mọ̀ nìyẹn. àjàmọ̀lá àgbọ̀lómi nínú tẹ́ kò sẹ́ni tó mọ̀ nìyẹn. àrẹ̀dẹ̀ ìdí ogun kò ṣe é rí kò sẹ́ni tó mọ̀ nìyẹn. àwọn aláfẹ́rẹ́ orí mi tètè yá fún mi o. àjàmọ̀lá ẹlẹ́dàá mi ọmọ wá gbé mi níjọ. ẹ̀pẹ̀ tún ní òye tọ́lá mo bá ròde. Túndé Arẹ́gbẹ́ ọmọ Arẹ́gbẹ́ àwọn tó yẹ tán lárò ọlọ́lá pàtàkì tí mo kọ́kọ́ rí Túndé yẹ tán lágọ̀gọ̀gọ̀ jáde Túndé ìjọba federal kò ní bàjẹ́ o ìjọba federal Túndé kò ní bàjẹ́ o Túndé yẹ lóní tèmi ọlọ́lá mo bá ròde o ọ̀rọ̀ rẹ ti di jésẹ̀ ọ̀rọ̀ rẹ ti dayọ̀ ọ̀rọ̀ rẹ ti dé ọ̀rọ̀ rẹ ti dayọ̀. Bóyá Túndé lónìí wípé ó yá olúwa ní tèmi o. Olúwa ní tèmi. Ọlọ́run ní. Ìsọ̀sẹ̀ká tó lé tù ú. Bàbá wa. Bàbá ọmọ ẹni nìkan ló ṣe. Aláàbò. Bóyá olúwa ní tèmi o. Olúwa ní tèmi. Ọlọ́run ní. Ìsọ̀sẹ̀ká tó lé tù ú. Eye bàbá ọmọ ẹni nìkan ló ṣe. Bóyá nítorí àwọn tí bfk yes bóyá bfk ló tún ní kí ṣe bẹ́ẹ̀ ó ní wípé ó ti ń ṣiṣẹ́ rẹ̀ bọ̀. bàbá ti ṣe láṣẹ pé àwọn Arẹ́gbẹ́ ó ti ń ṣiṣẹ́ rẹ̀ bọ̀ àwọn tó yẹ tọ́lá bàbá ṣe láṣẹ apc oníbàjẹ́ sẹ́ ó ti ń ṣiṣẹ́ rẹ̀ bọ̀. ẹ̀jọ̀ torí ọlọ́run tí ò bá náwó kó bá a bọ́ lẹ́nà o tí stéèjì bá ti já a. ó ti ń ṣiṣẹ́ rẹ̀ bọ̀. bóyá nítorí kúkú níjẹ̀bú ó de ti ẹ̀wẹ̀ sẹ́ o ẹ̀kú òbí o. Bọ́sẹ̀ wo tún dàgbà tó ń sẹ́. Bọ́sẹ̀ wo bí a ṣe dá. àṣẹdálé ayọ̀lẹ́gbẹ́ ọmọdé òní báyìí. Ayọ̀lẹ́sẹ̀gbọ́. Bóyá nítorí aya rẹ̀ gbòdì àti bọ́sẹ̀ yé mo bá ròde tí wá ní. Ó ti lórí tí mo tún máa bọ̀ fún gbọ́. Ẹni tí ò ní jò dú pẹ́sẹ̀. Ẹni tí ò ní jò dú pẹ́. Kúrò àwọn tó nínú wa tí ò fẹ́ràn wa. Kúrò àwọn tó nínú wa tí ò fẹ́ràn wa. Yóò ṣe ìwọ tó bá máa wúlò wúlò. Wúlò wúlò àbórí táwọn. Ẹni tí ò ní jò dú pẹ́sẹ̀. Ẹni tí ò ní jò dú pẹ́. Màmá kéye ló ní jò ní tiwa ní. Àmì tẹ́tù lọ́sẹ̀ kò fi dáadáa. Torí ẹni tí ó ní tó dùn pẹ́sẹ́. Àyà rẹ̀ yé mọ́ máa rò pé tiwa ní. Ẹni tí ó ní tó dùn pẹ́sẹ́. Akínyakí yé lè ní tòbí oṣù. Kí ló wí kékeré láàrin ọ̀pọ̀ ènìyàn. Akí ẹni tí ó ní tó dùn pẹ́sẹ́. Nítorí ayà rẹ̀ góòdù àti bọ́sẹ̀ mo fẹ́ kàn fún wọn wípé àwẹ̀ kọ́pẹ́tẹ́ tọkànnà mi kìlákìlá ayáyá. Bísẹ̀ bá lọ́nà mi rèpò ọmọ ọmọ mi o. Àwọn lọ́gbọ́n wé my light ayáyá. Bísẹ̀ bá lọ́gẹ́ mi ní ọmọ ẹ̀bà. Ṣé o ní fáwọn oníkó wa? Ẹlẹ́mi ló wà láṣẹ kí má láì. Mama gbé aya rẹ̀ dé bẹ̀sí lọ́wọ́ bẹ́sì. Wípé àbẹ̀sí ọ̀bọ̀ dé àbẹ̀sí lórí ẹ̀. Ó ti fi wèsì lọ́pọ̀ láti lè tàmínétọ̀. Wúgọ́gọ́ náà wúgọ́gọ́. Wúgọ́gọ́ náà wúgọ́gọ́ sẹ́. Bá lòdò bọ́sẹ̀. Mama gbé ìyẹ́lẹ̀ ní tèmi lòdò lẹ́wà. Wúgọ́gọ́ náà wúgọ́gọ́ sẹ́. Ọlọ́mọ tó ṣe ilé òkùnkùn onígbé ṣẹjá ọ̀rọ̀ lásán láàṣọ fún olùgbé tí kò rò mọ́lẹ̀. Àjọ máa lówó yìí ni kò jẹ́ bó bá ṣe jẹ́sẹ̀ tó bá yà tí rí bá ṣe fẹ́fẹ́ ṣáná àdúgbò. Ìkọ́tà ọlọ́run ní má bọ̀wọ́ sí ẹ̀yẹ fúnra. Àdúrà tó kù lọ́dọ̀ méjì tí wọ́n máa ṣe tuntun. Gbogbo ẹ̀rọ àti ìwà òní gbọ̀dọ̀ o. Jẹ́jẹ́ ṣàlàyé gbàṣẹ́. Màmá kéye lórí tèmi jẹ́jẹ́ láyé gbà. Àwọn tí Akin náà sanwó àyàkí lọ́wọ́lọ́wọ́. Torí èmi ìtọ́ra mi ò máa dúdú ṣiṣẹ́ àtẹ́lẹwọ́ ẹ̀mí. Màmá kéye èmi ìtọ́ra mi ò máa dúdú ṣiṣẹ́ àtẹ́lẹwọ́ ẹ̀mí sẹ́. Torí pé tó bá dẹ̀ tún rí bàjẹ́ bẹ́ẹ̀ ká ṣọ́mọ́ àdúgbò. Ìkọ̀tà ọlọ́run bí máa fọwọ́ sí ẹ̀yẹ gbẹ̀jọ́. Àdúrà tó kù lọ́gọ́ ní kí tiwa má ṣe gbẹ̀jọ́. Gbogbo ẹ̀yìn rẹ̀ lẹ́rọ̀ wá ti wá òní gbẹ̀jọ́. Torí jẹ́jẹ́ láyé gbà o. Jẹ́jẹ́ ló lè ṣe jẹ́jẹ́ láyé gbà. Bóyá nítorí màmá ké gbọ́n kọ̀lẹ́yọ̀mọ̀ ni. Màmá kéèrè kọ̀lẹ́yọ̀mọ̀ ni. Kọ̀lẹ́yọ̀mọ̀ ni. Kọ̀lẹ́yọ̀mọ̀ ni. Kọ̀lẹ́yọ̀mọ̀ ni. Gbéra gbéra o gbéra tó jẹ́ dàbúrà. Mo ní kò kálá kálá tó kó yẹ. Kálá tó kó yẹ lọ́wọ́ ìdílé. Olùdókòwò kò lọ kápá ìsọfọ́sí lè dá ilé.
For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace. His grace. I Jesus. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. His from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor. make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh, it is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh, forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord, I'm gonna let you do make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord, is gonna get up you to make every crooked way straight. It is forward ever, backward never. As far as your eyes can see, you carry grace. Oh. His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. Backward never. Hey, say, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. I say we move. We move. We move. We move. We move. We move. Hey, say it's my season of increase. Forward ever, backward never. It's my season of plenty. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, For the Lord has gone ahead of me to make every crooked way straight. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. It is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move. Because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord has gone ahead of you to make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord has gone ahead of you to make every crooked way straight. It is forward ever, backward never. As far as your eyes can see, you carry grace. His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. Backward never. Hey, say, He's my rock and salvation. Salvation. He's my helper and my anchor. It's my season of increase. Forward ever, backward never. I say we move. We move. We move. We move. We move. We move. Hey, say it's my season of increase. Forward ever, backward never. It's my season of plenty. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight. It is forward ever, backward never. make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh. It is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh. Forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move. Because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord, I'm gonna let you do make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord, is gonna get up you. Make every crooked way straight. It is forward ever, backward never. As far as your eye can see, you carry grace. Oh. His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. It's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. I say we move. We move. We move. We move. We move. We move. Hey, so it's my season of increase. Forward ever, backward never. It's my season of plenty. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, is my season of increase. Forward never, backward never. from glory to glory. It's my season of increase. Forward ever, backward never. Make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry favor. His favor surrounds me. ahead of me to make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh, it is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh, forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord has gone ahead of me to make every crooked way straight over. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. As far as your eyes can see, you carry grace. Oh, His grace. You carry favor. His favor surrounds me. Hey, it's my season of victory. Hey, say, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. I say we move. We move. We move. We move. We move. We move. Hey, say it's my season of increase. Forward ever, backward never. It's my season of plenty. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward. I carry For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh, it is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh, forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move. Because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord, I'm gonna lead you to make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord, is gonna head of you to make every crooked way straight. It is forward ever, backward never. As far as your eye can see, you carry grace. Oh, His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. Backward never. Hey, 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 hey. Say, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. Hey, 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 hey. I say we move. We move. We move. We move. We move. We move. Hey, say it's my season of increase. Forward ever, backward never. It's my season of plenty. Ay, ay, ay. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Hey, hey.
So we take the national anthem, please. Emeralds.
Take
Thank you very much, Emirate. A round of applause for this wonderful team, ladies and gentlemen. Thank you very much, Emirate. We appreciate you. Thank you. His Excellency, the Governor of Ondo State, Honorable Dr. Lucky Orimisan Ayedatiwa, ably represented by Special Advisor to the Governor on Health, the representative of Secretary to Government of Ondo State, Honorable Member, Ondo State House of Assembly, particularly the Chairman, Ondo State House of Assembly Committee on Health, Honorable Commissioners here present, the Director General Don Commission, Permanent Secretaries, Directors General, Executive Secretaries here present, other distinguished participants, gentlemen of the press, ladies and gentlemen. It's a wonderful day here in Akure, the capital city of the Sunshine State. And it's a great honor for me to welcome all our distinguished participants to this important gathering, which is focused on health insurance awareness and access in our region. We are not just gathered to discuss policies, but we are gathered to shine light on critical tools that protect individuals, families, and communities from the financial burden of unexpected health challenges. Ladies and gentlemen, a round of applause for yourselves as you are here this morning to be part of this great occasion. Thank you very much. It is hair that is real wealth, and not the pieces of gold and silver, and the greatest wealth in is health. Therefore, take good care of your health. Take good care of your body. It's the only place you have to live. On this note, distinguished ladies and gentlemen, it is my honor and privilege to welcome the representative of His Excellency, the People's Governor, visionary leader, passionate Governor of Ondo State, Dr. Lucky Orimisan Ayedatiwa, ably represented here today by no other person than his Special Advisor on Health, Professor Simidele Odimayo. A round of applause for the representative of His Excellency, the Governor of Ondo State. Thank you very much, sir. Also here this morning, ladies and gentlemen, is the representative of the Secretary to Government of Ondo State, Dr. Taiwo Fashoranti, ably represented here by the Permanent Secretary, General Administration Department, Reverend Shomo Ogunlade. You're welcome, sir. Thank you very much. A round of applause for him, ladies and gentlemen. Thank you very much. We also have in our midst the Chairman of the State House of Assembly Committee on Health, Honorable Member representing a very wonderful constituency in Ondo State, the Chairman House Committee on Health. Ladies and gentlemen, please put your hands together for Honorable Dr. Chris Ogunlana. You're welcome, sir. Thank you very much. Thank you. We appreciate you. Of course, we have in our midst the Honorable Commissioner, Minister of Health, Osun State, Barrister Jola Akintola. Honorable Commissioner, you're welcome, sir. A round of applause for him. Thank you very much, sir. You're welcome. Of course, we have the representative of the Director General, Dawn Commission, that's Development Agenda for Western Nigeria, ably represented here today by Mr. Abiodun Olajipo. You're welcome, sir. And I recognize all the officials from Dawn Commission here present. I welcome all of you to this occasion. Thank you very much. Let me recognize the Director General, Ondo State Contributory Health Commission, the host, DG, Dr. Abiodun Oyeneyi. Doctor, you're welcome, sir. Thank you very much. We appreciate you. And also want to recognize the Permanent Secretary, Local Government Service Commission, Ondo State, Dr. Bayo Ilawole in our midst. You're welcome, sir, Doctor. Thank you very much. Of course, we have the Permanent Secretary, Minister of Health, Ondo State, Dr. Adeniran Ikuomola. Doctor, you're welcome, sir. Thank you very much. I also want to recognize and welcome the Permanent Secretary, Hospitals Management Board, Ondo State, Dr. Ayodele Adiji. Doctor, you're welcome, sir. Thank you very much. Of course, we have the Administrative Secretary, Minister of Regional Integration and Diaspora Affairs, Ondo State, Mr. Olakunle Ajibade. You're welcome, sir. Thank you very much. Thank you so very much, sir. We appreciate you. I want to recognize the Executive Secretary Ondo State Drug and Health Commodities Management Agency, Pharmacist Amos Ayegbusi. You're welcome, sir. Thank you very much. Of course, we have the Executive Secretary of Ogun State Health Management Health Insurance Scheme, Dr. Dosumu Afolabi. Doctor, I welcome you, sir. Thank you very much, all the way from Ogun State. Thank you very much. The Executive Secretary of Osun State Health Insurance Scheme, Mr. Razak Akindele, is also here with us. Thank you very much, sir. Welcome you. Let me also recognize from Lagos State Health Management Agency, we have Mr. Rotimi Olatunji, all the way from Lagos. Thank you very much, sir. You're welcome. I want to recognize Dauda Stephen from Oyo State Health Insurance Scheme. He's the Director of Marketing, all the way from Oyo State. You are welcome. Thank you very much. Distinguished ladies and gentlemen, they will continue with the introduction in the course of the program. At this juncture, I want to humbly welcome to the podium for a welcome address that will be delivered by the Director General, Ondo State Contributory Health Commission. Ladies and gentlemen, please put your hands together for Dr. Abiodun Oyeneyi. You're welcome, sir. A round of applause for him, ladies and gentlemen. Dr. Oyeneyi is a public health physician and management consultant with vast experience in health financing, research, and public policy. He's an alumnus of the University of Lagos and the University of Aberdeen. Please put your hands together once again for Dr. Abiodun Oyeneyi. You're welcome, sir.
His Excellency, the Governor of Ondo State, Dr. Lucky Orimisan Ayedatiwa, ably represented by the Special Advisor on Health, Professor Michael Semidele Odimayo, the SSG, Dr. Taiwo Fashoranti, ably represented by the Permanent Secretary, General Administration, the Chairman, House Committee on Health, Dr. Ogunlana, the representatives of the Head of Service, Mr. Bayo Philip, Dr. Niro Ikuomola, who is also the Permanent Secretary, Ministry of Health. I recognize also the Permanent Secretary, Hospitals Management Board. Let me digress a bit. Sorry, let me recognize the Honorable Commissioner in our midst, all the way from Osun State. You are welcome, sir. We also have in our midst the Director General of the Dawn Commission, ably represented. We have the representatives of the National Health Insurance Authority, also in our midst. We have UNICEF here represented, the Executive Secretary, Ondo State Drugs and Health Commodities Management Agency, the Permanent Secretary, Ondo State Local Government Service Commission. We have in our midst all the Executive Secretaries and Permanent Secretaries of the State Social Health Insurance Agencies of the Southwest. I will start with Ekiti State in alphabetical order. We have Dr. Doherty with his team. You are welcome, sir. We have from Lagos State, Dr. Emmanuel Samba, ably represented in our midst, Lagos State and the team. You are welcome from Lagos State. Eko Nibajeo. We also have from Ogun State, my brother and my very good friend, Dr. Afolabi Dosumo and his team. Can we give them a round of applause? We have also, I've recognized the Honorable Commissioner. We have the Executive Secretary from Osun State, my very good brother also here in our midst, Dr. Akindele. And from Oyo State, Dr. Shola Akonde and his team, they are here. Dr. Shola Akonde is ably represented, and the team are also here. Let me also recognize representatives of our organized labor present here. We have Nolge representative. You are welcome, ma. We also have the representatives, the chairman, CSOs, chief in our midst. You are welcome, sir. All directors from the Ondo State Contributory Health Commission, the management team and staff, ladies and gentlemen. Let me adopt the already established protocol in case I missed anyone out. It's not by design. It is with great pleasure that I welcome all distinguished government of functionaries, the Honorable Commissioner in our midst, delegates from the 6 southwestern states, representatives of Dawn Commission, our partners, UNICEF, WHO, and stakeholders to this very important conference being hosted by the Ondo State Contributory Health Commission in collaboration with the Dawn Commission. Your presence here today reflects a shared commitment to advancing health insurance coverage and improving the well-being of our people across the southwest region of the Federal Republic of Nigeria. The theme of this conference, Attaining Universal Health Coverage Through Strengthened Health Insurance Scheme, highlights a critical goal that we all strive to achieve. And the keynote speaker would have loved to be here, but there was no flight to convey him from Abuja to Ondo State this morning, and he will be delivering his lecture. It's Dr. Olumide Okunla from the World Bank. It speaks to the collective responsibility we bear to ensure that quality health care is within reach of every individual, regardless of their background or means. As we come together over the course of this conference, we have a unique opportunity to exchange ideas, share experiences, and explore innovative solutions that can accelerate progress towards the attainment of universal health coverage. The challenges we face are complex, but through collaboration and determination, they are surmountable. The Southwest states have made meaningful strides in expanding health insurance coverage and improving health outcomes, but we recognize that more work lies ahead. This conference is a platform to deepen our understanding of the barriers to coverage, identify best practices, and strengthen partnerships that will drive sustainable change. I encourage all delegates to engage actively, ask probing questions, and contribute to knowledge. Your insights are invaluable as we seek to build a health insurance system that is accessible, affordable, and trusted by all our people. I would like to extend special thanks to His Excellency Dr. Lucky Orimiso Ayedatiwa for the enabling environment and giving us the support to be able to host this program. Your Excellency, we really appreciate you, sir. I thank the Dawn Commission for their leadership and support in fostering regional cooperation. I thank all the delegates from the South Western region, state social health insurance agencies. Together we can harness our collective strengths to build a healthier, more equitable Southwest. Once again, welcome to this conference. I look forward to productive discussions and meaningful outcomes that will bring us closer to the attainment of universal health coverage. Once again, welcome to the Sunshine State, and I wish you a memorable stay. Thank you, and God bless you all.
Thank you very much. A round of applause for the Director General, Contributory Health Commission, Ondo State, Dr. Abiodun Oyeneyin. Thank you very much, sir. He has said it all that with all our support and collaborations, we will definitely surmount all the challenges facing healthcare delivery system in our region. A round of applause for him, ladies and gentlemen, once again. Thank you very much, sir. We appreciate you. A quick recognition of the following dignitaries in our midst. I'd like to recognize the Senior Special Assistant to the Governor of Ondo State on Community Integration. Is also the State Focal Representative on Dawn Commission. Ladies and gentlemen, put your hands together for Honorable Muyiwa Ogunyemi. Honorable, you're welcome, sir. Thank you very much. And I also want to recognize the representative of the Permanent Secretary, Office of Establishments and Training, Ondo State, Pastor Sunday Lade Omire. You're welcome, sir. Thank you very much. He's the Director of Industrial Relations of the office. Thank you very much. We appreciate you. At this juncture, ladies and gentlemen, we want to listen to the prefatory remarks by the Director General Dawn Commission and the Director General, Mr. Sheye Oyeleye, who is able represented here today by one of the top officials of the Commission. Ladies and gentlemen, please put your hands together for the representative, Mr. Ladipo. You're welcome, sir. Thank you.
Thank you so much, sir. Good morning, everyone. We thank you for being here today. And just on behalf of the DG Dawn Commission, I want to sincerely convey his apology for not being here presently. We were meant to be here together yesterday, but an urgent call came in from one of our principals. You know, when you work for 6 states, urgent calls can come in from any angle. So just yesterday, an urgent call came in from him, and I said we should go ahead, I will join us. But we learned that this morning he has to be in Lagos, you know, to see the governor of Lagos. That's why he's not here this morning. Hopefully, before the end of today's sessions or tomorrow's sessions, he will join us. But I have his remark here that I'm going to read out. And thank you so much for your understanding. Well, let me, because I'm not good with the protocol stuff, but let me just rest on the 16 protocol as it has been established by the MC and then the DG of Ondo State Health Insurance. So I'll just go straight to his speech. The Southwest Regional Health Insurance Health Roundtable represents a significant milestone in our collective journey toward achieving universal health coverage in our region. Of course, we appreciate the Ondo State government for graciously hosting these important conversations, and we must say that this is beyond our expectation. We thought we were going to be just in one small room and just have conversations, but we think that it shows the kind of importance that was attracted to these events. So we appreciate Ondo State government as represented by His Excellency the Governor and all the team and the committee. Please let's appreciate them. Really appreciate. As we gather here in Akure, we are united by a shared vision and common challenge, The statistics speak volumes about the urgency of our mission. About 75% of our healthcare expenses in Nigeria remain out-of-pocket expenditure, placing a huge burden on the citizens and creating barriers to healthcare access that no society should endure. This reality underscores why regional collaboration in health insurance has moved from being merely desirable to absolute essential. Dawn Commission has conveyed this in conjunction with Ondo State Government, has conveyed this roundtable because we recognize that the path to universal health coverage should not be walked alone by individual states. While each of our Southwest states have made commendable progress in implementing state health insurance schemes, we have also observed that our collective impacts can be exponentially greater when we harmonize our efforts, share our experiences, and leverage our combined strengths. This gathering is a strategic convergence of minds, resources, and political will. We have brought together the key architects of health policy in the region, of course, the commissioners who shape health agendas, the CEOs and directors of state health insurance agencies who implement life-changing programs, and technical experts who provide the knowledge foundation for our decision. We have UNICEF in the room, and Dr. Olumide Okunla of the World Bank is unable to make it physically, but is going to join us via virtually to present his paper. You know, we've been working with them. We've been working, and we think that they have a lot to also offer the region in terms of universal health coverage. Our objectives for the next 2 days are clear and ambitious. We seek to foster meaningful partnership that will mobilize sustained support from critical stakeholders. This actually meant to be the meetings of the health insurance managers, but we decided to also include the commissioners because we need their support, you know, to scale up what the states are doing on health insurance, so that some of the obstacles to effective performance of the health insurance can be heard directly from them, and they can also compare notes with the other states, so that they can improve the other states and even global practice, so that they can improve on what they have currently in their state. The goal is to develop, we seek to foster meaningful partnership that will mobilize sustained support from critical stakeholders, and most importantly, to develop practical, actionable recommendations that will harmonize our health insurance policies across states' boundaries. The goal is simple, yet transformative, that ensuring that a citizen from Lagos, a resident of Lagos, can access quality health care in Oyo if he's in transit, or when Ekiti enrollee is in transit, can also access medical attention in Osun if there is any need. So that's the objective, because the Dawn Commission, we see the entire 6 states as one entity, as we used to know it, the Western region. So the artificial barrier, Dawn Commission is working towards removing that artificial barrier to let the states cooperate, you know, and collaborate to improve the welfare of citizens. And that's exactly why Dawn Commission is established by the government of Southwest State. And so we want to also replicate that in the health insurance scheme, so that if I am an enrollee in Osun State and I'm going to Lagos and something happens and I just need to access medical attention in Ibadan, I can easily walk into an hospital and say, I'm an enrollee on Oyo Ekiti Health Insurance Scheme. The concept of portability and continuity of care is a fundamental right that our people deserve. When we achieve this, we will have created something unprecedented, a truly integrated regional health insurance system that serves as a model for other regions in Nigeria. As we embark on these deliberations, I encourage us to think beyond the boundaries of our individual states and individual agencies. Let us envision a Southwest region where geography does not determine the quality of healthcare one receives, where financial constraints do not dictate health outcomes, and where our collective resources are optimized to serve every citizen equitably. I'm confident that the expertise, experience, and community represented in this room will produce insights and agreements that will accelerate our progress toward universal health coverage. We must ensure that no one is left behind in our pursuit of health equity, and that the Southwest region becomes a beacon of excellence in health insurance delivery. Thank you for your presence. I want to once again particularly appreciate His Excellency Governor Loki Aiyedatiwa and the Ondo State government for hosting this very beautiful edition of our meetings. Your commitment and readiness to contribute to the vital conversation is greatly appreciated. Thank you.
Thank you very much, Mr. Abiodun Oladipo. A round of applause for him, ladies and gentlemen. He has represented the Director General of Dawn Commission, Sheye Oyeleye. A round of applause for him once again, ladies and gentlemen. Thank you very much. Dawn Commission, the commission set up by the government of the Southwest states of Nigeria as an institutional and program management body to midwife their regional integration agenda. And I want to believe that this wonderful commission has been doing a wonderful job in this region. If we believe in that, please put your hands together for Dawn Commission. Thank you very much. I also want to congratulate the Ondo State Contributory Health Commission under the Director General, Dr. Abiodun Oyeneye, for doing a wonderful job in the state. I say congratulations on the 6th anniversary yesterday, sir. Congratulations, sir. Please put your hands together for Ondo State Contributory Health Commission, marking 6th anniversary yesterday with a laudable achievement in the health sector of the state, providing quality health care to the people of the state in all ramifications without financial hardship. Congratulations, Contributory Health Commission on the state. Thank you very much. At this juncture, ladies and gentlemen, I want to humbly invite this wonderful choral team, the Emirates Perfect Expression, a multi-award-winning group, to please come forward and perform for us. Please put your hands together for Emirates. Thank you.
Your Excellency, all protocols duly observed. We have a special song. We call it the theme song for our insurance scheme in Ondo State. I understand that Lagos have their own, and we have come up with a beautiful one for Ondo State. Osun has their own too. Okay. The song says, Ilera, Ilera, Ebojuto, má ṣe jáfara, má ṣe sùnlé, ètò ìlera dójútòfò, ìlera ẹ̀bójútó. You are blessed as you listen. It's a beautiful song. Yes, we cannot know it now, but at least we'll have the idea. We're going to make it to be a color tune for most of us so that it goes viral. Beautiful song. Let's enjoy it. It's my prayer that we will not sleep on our health, because health is wealth. Thank you. God bless you. As if we shouldn't end the song. We'll take it one more time. So when we get to oranges will all stand up so that the video can, pick us while we enjoy the song together. Let's go again, Emeralds. Let's go.
Ètò ìlera dójútó fòré, ìlera ẹ bójútó. Má ṣe jáfọ́rọ́, má ṣe sùnlé. Ètò ìlera dójútó fòré, ìlera ẹ bójútó. Oranges, oranges, oranges insurance scheme. Lábẹ́ ìjọba ìpínlẹ̀ Ondo, ìlera ẹ bójútó. Oranges, oranges, oranges insurance scheme. Oranges, oranges, oranges insurance
Ladies and gentlemen, a round of applause for Emirates Perfect Expression once again. Thank you very much. Thank you very much, Emirates, the multi-award-winning group. Thank you very much. The representative of His Excellency, the Governor of Ondo State, other distinguished ladies and gentlemen, we are going to skip the next item on the program, which is Governor Speaks, because Mr. Governor, when he speaks, nobody speaks after the Governor. So we want to skip that one to take the next item, which is objectives and expresses outcomes. On that note, ladies and gentlemen, let me invite Ms. Mayowa Ajayi to please step forward on behalf of Dawn Commission to take that item on the program. Thank you.
Good morning, everybody. Good morning, everyone. I'll continue on the existing protocol that HOP has started, and every other, the MC and the DG for ODCHC. So I'll be welcome to the Southwest Regional Health Conference for the health insurance. I'll be taking us through the objectives for this meeting. The first one is to provide an avenue to mobilize support for critical stakeholders towards an effective health insurance scheme in the Southwest. This objective recognizes the sustainable health insurance reform requires coordinated support from all the stakeholders. That's the critical stakeholders that we invited for this event. That's the commissioners, the health insurance CEOs, the National Health Insurance Authority, UNICEF, and Dr. Okola from World Bank. The roundtable will serve as a neutral platform where the stakeholders can align around a common goal, share resources, and commit to collective action. The success in this area will provide political will, financial backing, and social support necessary for the implementation and sustenance of health insurance within our states and the region as a whole. The second objective is to foster learning, partnership, and collaboration among state Southwest health insurance schemes to improve the healthcare system. The roundtable is supposed to create a structured collaboration, structured environment for knowledge exchange, feedbacks, decision-making sharing, joint problem solving. By facilitating partnerships between the agencies, the initiative aims to build a network of collaboration that can address challenges within the system. when we have all the health insurance schemes together, all the state health insurance schemes together, we're able to draw learnings from each state where we can address problems that are unique to state Lagos or state Ekiti that would address the problems or solve a problem that's affecting them in Ondo State. Then the last one is also to create a path towards harmonized health insurance policies and operational frameworks across states to ensure portability and continuity of care. Like Mr. Abiodun said when he was reading the prefatory remark, one of our goals in Dawn Commission is for us to create a regional health insurance system where you come from Lagos State and you can access care in Ondo State or from Oyo State to Ogun State. So when we're able to harmonize the health insurance system between the states, the effort would focus on, it would reduce the bureaucratic challenges in accessing healthcare services by the citizens, and this harmonizing effort would focus on developing a seamless healthcare financing system that will serve as a mobile Southwest population while maintaining local flexibility and accessibility for citizens in the Southwest. Thank you very much, sirs.
Thank you very much, Ms. Mayowa Ajayi, on behalf of Dawn Commission. She has explained to us the objectives and expected outcomes from this conference. Please, let's appreciate her with a big round of applause. Thank you. Thank you very much. The next item on the program is a paper to be presented by Dr. Olumide Okunla of the World Bank. The title is Attaining Universal Health Coverage Through our Strengthened Health Insurance Scheme. Please, let's welcome with a big round of applause Dr. Olumide Okunla from World Bank. Ladies and gentlemen, let me humbly recognize the #1 journalist in the state, the chairman of the Ondo State Council of the Nigerian Union of Journalists, Prince Leke Adegbite in our midst. Prince, you're welcome, sir. Thank you, Mr. Chairman. That's my chairman. Thank you very much. While we are with Dr. Okunla for his lecture, I want to recognize all the directors from the Ondo State Contributory Health Commission, Mrs. Olakanye, the DFA, the Director, Business Development, and other directors from the Ondo State Contributory Health Commission. I recognize all of you. Please let's put our hands together for all these wonderful gentlemen and ladies for the wonderful job they are doing. Thank you very much. Yes, Mr. Ladipo. Okay, thank you. I apologize for that short break in transmission. We are working on the technical aspects of the paper so that we can have it on the screen. Please bear with us for just one. Okay. Dr. Okunola Olumide from World Bank.
That the slide moving.
The slide is moving.
Or you can hear me. That the slide moving.
Yes. Please continue. The slide is moving.
That the slide, yes, moving. I just realized that the slide isn't moving from here.
Please continue. The slide is moving.
Or you can hear me. That the slide, yes, moving. I just realized that the slide isn't moving from here.
Please continue. The slide is moving.
That the slide, yes, moving. I just realized that the slide isn't moving from here.
Please continue. The slide is moving. You can see your screen, sir.
You can hear me. That the slide, yes, moving. I just realized that the slide isn't moving. Yes, the problem is this. The slide is not moving.
The slide is
Your hand.
It's moving.
Is it moving?
You can see your screen, sir.
Okay, all right. Please, unfortunately, I can't seem to have the hang of the technology, but I'll just breeze through the presentation because once I put it in presentation mode, the slides do not seem to be moving. So please permit me if I just present it this way. And like I said before, I'm going to be the technology, but I just want to give brief things. One is to very quickly, because once I put it in what I think are our immediate. So please permit me if I just present it this way. And like I said before, I'm going to be the technology, but I just want to give brief things. one Southwest state because where we are within what I think our last result. So please, a couple of what I just presented opportunities. Like I said before, I'm going to be technology, but I just want to be one Southwest state because where we are within what I think our last result. So please, a couple of what I just presented opportunities. Like I said before, do you please confirm this? I just want to be one Southwest state because where we are within what I think our last result. So please, a couple of what I just presented opportunities. Essentially, the concept of health.
Please, we're sorry for the poor audio quality of that presentation, so we keep it on, put it on hold. We'll come back to it later. Therefore, ladies and gentlemen, I want to humbly invite.
Of health insurance. So the premise of my presentation is how are we able to achieve this noble goal of cost subsidization. In fact, one of the earlier speakers in today's meeting mentioned something about, look, how can we as the states in the Southwest regions come together to implement something like the regional health insurance. If you are able to speak in that meeting, mention for the boundary and how can we solve it? Because essentially what you're doing is concept of if you are higher scale.
When we get the clear audio, we'll come back to him. Please let's put him on hold. When we get the clear audio policy, we'll come back to him. Thank you. Please, let's put it on hold. Thank you very much. Distinguished ladies and gentlemen, we want to, at this juncture, invite the representative of His Excellency, the Governor of Ondo State, Dr. Lucky Orimisan Ayedatiwa, who is ably represented here by his Special Advisor on Health, Professor Simidele Odimayo, to please step forward and deliver Mr. Governor's address and declare the conference open. A round of applause for His Excellency, the Governor of Ondo State. Thank you.
Please have your seats. The Secretary to the State Government, ably represented by Reverend Somo Ogunlade, the Permanent Secretary Guard. Thank you for coming. The Chairman of the Medical Committee of Ondo State House of Assembly, Dr. Ogunlana. I want to appreciate the Honorable Commissioner for Health, all the way from Ondo State, from Osun State, who is there in person to be sure that he is able to participate fully. We appreciate you, Barrister Jola Akintola. I'm very happy that you are in love with Ondo State. The other day when Her Excellency, the wife of the President of the Federal Republic of Nigeria came, you were here. Thank you for coming. We appreciate you. The DG Down Commission has been represented by Mr. Abiodun Oladipo. We welcome you. Thank you very much. The Permanent Secretary, Ondo State, Dr. Ojo Adiji. Thank you. There is a little maze up here. Please permit me to stand on the already established protocol. I know that the Permanent Secretary of Ministry of Health is also representing our dear Head of Service. Thank you for coming. We appreciate. We have the board members of Ondo State Hospital Management Board here. I saw them on the screen. You are welcome. Thank you very much. Dr. Wilson, pharmacist. Taiwo Adefurin, thank you. We appreciate you. We want to appreciate the AS and delegates of health insurance agencies in the Southwest, starting from Ekiti, going to look at each and every Lagos, Osun, Oyo. We appreciate you for coming. We know you have been doing a great job, and this decision or plan to really allow for free flow of health insurance across the Southwest is a fantastic one, and is really a great innovation, and we really appreciate you for this. All the permanent secretaries that are here, directors, organized labor leaders, we have the chairman of NUJ here. We thank you very much. You have always been with us, giving us excellent reportage and leading the entire media team to be able to support the government for good governance. We appreciate you, Mr. Chairman. Members of press that are here, ladies and gentlemen, I bring greetings from His Excellency, the Governor of Ondo State, Dr. Loke Orimisan-Ayedatiwa, who is unavoidably absent because he has to do something outside the state. It is both an honor and a privilege to welcome you to the Sunshine State for this landmark conference organized by the Down Commission. Today, we stand at a critical junction in the history of our region, a moment that calls for vision, courage, and collective action. The theme of this conference, attaining universal health coverage through a strengthened health insurance scheme, is not only timely, but also deeply relevant to the aspirations of our people. It is a theme that speaks to the heart of our commitment as leaders and a people to ensure that every individual, regardless of their social or economic status, have access to quality healthcare service without any form of financial hardship. Ladies and gentlemen, access to good healthcare service is the bedrock of any prosperous society. It is the foundation upon which we build healthy families, productive communities, and a vibrant economy. Without good health, our children cannot learn, our youth cannot walk, and our elders cannot enjoy the fruit of their labor. Universal health coverage is not merely an agenda, it is a moral imperative. As a government, we have seen firsthand the devastating impact that lack of access to health care services can have on our people. We have heard the stories of mothers who could not afford to take their children to the hospital. We've heard about the story of breadwinners who lose their livelihood to illness. And we have heard about communities that suffer needlessly from preventable diseases. These stories are a call to action, a call that we must answer with urgency and determination. Over the past few years, Ondo State has made significant progress in the health sector. We have revitalized our primary health centers, improved maternal and child health outcomes, and launched innovative programs such that the Abiyamo Maternal and Child Health Insurance Scheme and oranges for both formal and informal sector. Our State Health Insurance Commission has made giant strides in providing health insurance cover to our residents, and this we are very proud of. I want to sincerely appreciate all the members of the health team. I want to appreciate especially the members of the Contributory Health Commission of Ondo State, led by Dr. Abiodun Oyeneye, and we thank God for the entire health sector for the beautiful work they are doing. I want to say that we just need to move on. We are proud of you, and we know we can still achieve more. We must acknowledge that challenges remain in the level of health insurance coverage in our country. The journey to universal health coverage is a marathon, not a sprint. We must address issues of inadequate funding, low enrollment in health insurance schemes, gaps in infrastructure, and the need for more skilled health workers. We must also confront the realities of poverty and inequality, which continue to limit access to quality care for many of our residents. It is in this context that the health insurance becomes a powerful tool for social protection and equity. A robust health insurance system spreads the financial risk of illnesses across the population, ensuring that no one is forced into poverty because they fall sick. It encourages preventive care, reduces out-of-pocket spending, and strengthens the overall health system. For health insurance to be truly effective, it must be accessible, it must be affordable, and trusted by our people. We must work together, therefore, to address barriers to enrollment, particularly among those in the informal sector, among those in the rural communities, those that belong to the vulnerable groups. We must ensure that the benefit package is comprehensive and that the services are delivered promptly and with dignity. Today, I call on all stakeholders, that is government agencies, healthcare providers, civil society organizations, traditional leaders, and our partners in the private sector to join hands in this noble endeavor. Let us leverage the power of partnership and innovation to expand coverage, improve service delivery, and build a healthy system that can work for everyone. I'm particularly grateful to the Down Commission for its leadership in promoting regional integration and shared prosperity. Your support and collaboration have been instrumental in driving progress, not only in Ondo State, but across the Southwest region. Together, we can learn from each other's successes and challenges, share best practices, and build a stronger, more resilient health system for our people. The Southwest region has been a beacon of hope, has been frontier in ensuring that we have a progressive nation. And taking a lead in this health insurance system is particularly heartwarming. And I want to congratulate you all that is here for this. As we deliberate over the next few days, let us keep our eyes firmly fixed on the future. Let us ask ourselves, what kind of health system do we want to leave for the next generation? Let's ask ourselves, what type of health system do we want to experience when we are no longer as active as this? What type of health system do we want to meet at the time where we are very old and we are just totally dependent on others? That is the type of health system we should begin to work to put on ground, even if not for others, even for the sake of our own longevity. But of course, better for the entire nation and especially our people. How can we ensure that every child born in the Southwest region and the nation as a whole has the opportunity to grow up healthy, strong, and productive? How can we create a society where no one is left behind? I'm confident that with your expertise, commitment, and passion, we can find answer to these questions. So let us build bold, thinking system. Let us be innovative in our approach and steadfast in our resolve. In closing, I wish to reaffirm the unwavering commitment of the Ondo State government to achieving universal health coverage. We will continue to invest in our health system, strengthen our health insurance scheme, and work tirelessly to ensure that every resident can access the care they need when they need it and where they need it. And I'm particularly happy that this is one of the major goals of this meeting, that anybody, any of our citizens in the Southwest can at any point in time when there is need access health insurance, health services anywhere within the Southwest. If we can take this lead, I'm sure it can become even a national program that can really become so good that we'll be proud of. Let us seize this moment to make history. Let us work together to build a healthier, more equitable, and more prosperous Southwest region, where every life is valued and every person can strive. I want to thank you for your attention. I want to thank you for your partnership and your dedication to this vital cause. And I wish you all fruitful deliberation and successful conference. God bless Ondo State. God bless the Southwest region. God bless the Federal Republic of Nigeria. And so, thank you very much. It is on this note, I hereby declare the conference open. Thank you. God bless you.
Thank you very much, sir. The representative of His Excellency, the Governor of Ondo State. Please keep applauding the representative of the Governor until he gets to his seat. Thank you very much, sir. Thank you, Professor Simidele Odimayo, Special Advisor to the Governor on Health. Thank you very much, sir. He's a fellow of the National Postgraduate Medical College of Nigeria, as well as member of the United Kingdom Research Institute Peer Review College. A round of applause for him, ladies and gentlemen. Thank you very much, sir. A quick recognition of the following dignitaries before we proceed on a tea break and take photographs. I want to recognize the former President, Nigerian Medical Association Ondo State, currently Special Assistant to the Special Advisor on Health, Dr. Dolani Gbelela. Dr. Gbelela, thank you very much, sir. I appreciate you. Director, Plan Research and Statistics, Ondo State Ministry of Health, Dr. Adesoji is here with us. You're welcome. Thank you very much. Director, Plan Research and Statistics, Primary Care Development Agency, Ondo State, Dr. Yetunde Olagbuji. You're welcome, ma. Thank you. And also Director, Plan Research and Statistics, Hospitals Management Board, Ondo State, Dr. Abe is also here with us. Thank you very much. And all other directors from other MDS present, I welcome all of you to this conference. Thank you so very much. At this juncture, Your Excellency, distinguished ladies and gentlemen, we now take good photographs. After that, we go on tea break. After that, we'll come back for the rest of the program. Thank you, ladies and gentlemen, and have a wonderful day in Ondo State. Thank you. Please elect the representative of the governor and the representative of Dawn Commission, the special, honorable members of assembly, permanent secretaries, and after that, maybe the executive secretaries will join. Sir?
Okay, they remove.
Hello? Honorable Commissioner for Health, sir, Osun State. So, I want to
make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh. It is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh. Forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of God, we move. We move. We move because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord has gone ahead of you to make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord has gone ahead of you to make every crooked way straight. It is forward ever, backward never. As far as your eye can see, you carry grace. Oh. His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. Forward ever, backward never. Hey, say, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. I say we move. We move. We move. We move. We move. We move. Hey, say it's my season of increase. Forward ever, backward never. It's my season of plenty. I say we move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I gone ahead of me to make every crooked way straight over. It is forward ever, backward never. You are going forward, forward ever. Hey, for the Lord has gone ahead of you to make every crooked way straight over. It is forward ever, backward never. I carry grace, His grace. I carry favor, His favor surrounds me. It's my season of increase. Oh. It is forward ever, backward never. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Oh. Forward ever, backward never. Hey, hey, hey. That's how we move. 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 Oh, it's my season of increase. Forward ever, backward never. Hey, supernatural speed. We move. We move. We move. With the speed of light, we move. We move. We move because it's my season of increase. Forward ever, backward never. Hey, I'm going forward. Forward ever. For the Lord, I'm gonna do to make every crooked way straight. Forward ever, backward never. Hey, 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 hey. Say, you are going forward. Forward ever. For the Lord is gonna get of you to make every crooked way straight. It is forward ever, backward never. As far as your eyes can see, you carry grace. Oh. His grace. You carry favor. His favor surrounds me. Hey, it's my season of increase. Hey, it's my rock and salvation. Salvation. It's my helper and my anchor. It's my season of increase. Forward ever, backward never. I'm sure we move. We move. We move. We move. We move. We move. Hey, so it's my season of increase. Forward ever, backward never. It's my season of plenty. I'm so we move. We move. We move. We move. We move. It's my season of increase. Forward ever, backward never. Yes, we move from glory to glory. It's my season of increase. Forward ever, backward never. For the Lord has gone ahead of me to make every crooked way straight over. It is forward ever, backward never. Oh, you are going straight, forward never, backward never. Hey, 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 hey. Say, you are going forward, forward.
5. Basically, what slide number 5 is saying is that Nigeria's human capital index is very low, considering Nigeria's level of wealth. With a human capital index of 34, this is the 6th lowest in the country, and it means that for a country who will rely on its people for its future competitiveness, then it means there is a challenge. I am putting all of this up front because we need to make a case. We need to make an economic case for why state governors, why State House of Assembly should invest in health insurance. So I will be speaking less. In fact, I'll be saying very little about health insurance. Rather, I'll be saying on what state governments or what the Southwest as a region hope to gain by actually expanding health insurance coverage. If you go to the next slide, please. The slide is simply showing the kind of disparities that exist amongst regions in Nigeria and among states. While some states are doing pretty well, some are really doing very badly. And I will be able, as we go in the course of this presentation, show some of those geographical disparities. Whilst we can conclude that the northern part of the country is doing rather poorly and the south is doing better, but if we disaggregate, even within the southwest, as you will soon see, then it shows that we need to up our game. Going to the next slide begins to then tell us, why is this situation like this? The first thing that hits us is that the amount of financing that we are budgeting for health, for education, is certainly not enough. But before I even get to the sectoral allocation, let's even look as governments, how much are we even spending? And the chart you're seeing before you shows that the level of government spending across all sectors is particularly low. You may want to say that, you cannot spend what you don't have. This is true, but you will begin to see when I begin to talk about opportunities, especially for states. One major opportunity we have ahead is right now, and maybe this should be the first key message. If you've not been hearing me before, the first key message, I'm fast tracking my slides. The first key message here is that Nigerian state governments are now making double the amount of revenue they were making before. Let me repeat that. Maybe you didn't hear me. Nigerian state governments are now making double the revenue they were making compared to 2 years ago. In fact, some states will be making 3 times the revenue. But hold on, but that's my first key message. If I go to the next slide, which then tells us, yes, government is not spending money across all sectors, or not spending enough money across all sectors. But if you then come to how much government is spending, first let's look at what's the health spending, public health spending relative to the size of the economy. At less than 1% of GDP, this is one of the lowest. This is one of the lowest in the world. Again, considering Nigeria's level of wealth, if we're spending 0.5% of our GDP on health, of public spending on health, this is very low. You cannot make something out of nothing. If that level of spending is that low, then don't expect to find particularly improved health outcomes. In fact, what that translates to, I'm now on on the next slide, what that translates to is that in absolute terms, what that means is that governments were spending in Nigeria about $11 per capita. In fact, if we break that, it's almost half. So the level of state government spending and federal government spending, at the end of the day, we have about $11 per capita. This, again, is one of the lowest in the world. And you can compare that to what we spend on defense. Yes, perhaps one of the reasons for this is that government is spending a lot more on debts. If you look at the amount of debts that governments, not just in Nigeria, but across other countries, there's a lot of public interest payments relative to health expenditure. Also, you have security challenges. So a lot of those monies that ideally should be coming to health, education, and such productive sectors is being used on other things. But at the end of the day, what you spend on health is a matter of choice, regardless of what your revenue is. And this particular point is now going to become very, very important as I wind down my presentation. Because like I said, and I need you to keep that, is that the amount of revenue that state governments are making now means that whatever is prioritized in the budget becomes very important because there's cash backing for budgets. And as at today, if you look at the amount allocated to health relative to government budgets is in the region of, for most states, it ranges between 4 to 12%. I am on slide 12, and what that slide is saying is if we compare Nigeria's level of health spending to other countries, some of them were much more wealthier than them, you will see how low the level of spending is. This issue of financing becomes worse. Again, the slide I am on now talks about the impact of development assistance for health. Most of the partners that have been supporting our health sector have exited. That is no more news. The news now is how do governments now step into the shoes of entities like USAID, FCDO. Most are quite active in several of the southwestern states. And I would urge colleagues to say this is an opportunity to begin to make a stronger case for our governors to say, look, several of the programs that have been supported and driven by development partners, they've exited. And we now need government-owned financing to step in. At the end of the day, we have a problem of allocation, we have a problem of execution, we have a problem of fragmentation, we have a problem of sequencing. So just to show you that even with the low level of public expenditure or the low level of public financing that we allocate to health, some countries, despite the fact that they even have just similar to what we are spending, they are even getting better outcomes. And many people in the room perhaps will be with experience of Bangladesh. Bangladesh is spending about $9 per capita, but if you compare its maternal mortality rate, which is about 100 per 100,000 live births, compared to Nigeria, which is 1,000 per 100,000 live births. So it means that despite the fact that we're not spending enough, we're also not spending efficiently. What has the outcome been? As you can see, you have a lot more Nigerians falling into poverty, whilst the level of poverty is much more concentrated in the north. If you come to the southwest and further disaggregate, you will realize that even the level of poverty is rising in several southwestern states as well. Please, if you can go to slide 18, slide 18 simply shows, results of health outcomes from a mixed survey that was done by UNICEF about 3 years ago, which shows that even within the Southwest, our health outcomes is greatly varied. While some states are doing particularly well, you have states like Lagos or Osun who have some of the best under 5 mortality rates compared to states like Ekiti in terms of under 5 mortality rate, which is much better than the rest of the country, but it still shows that there's still a lot of work to be done. But my next slide actually is very telling, because if we say on slide 18 that Lagos is doing very well and in fact has one of the best health outcomes in the country, if we then take Lagos as a country, if Lagos were a country, Lagos would be an upper middle income country. So let us put it in the categories of upper middle income country. Lagos then becomes an outlier, because that result that shows that it's very good is actually very bad. So this is something to chew on. And then if you go to the next slide, the federal government recently classified the local governments with the highest maternal mortality in the country. These local governments, 172 of them, make up 50% of maternal mortality in Nigeria. Amongst them, we have about 13 to 15 local governments in the Southwest, contributing the highest maternal mortality in Nigeria. So it means that yes, we are doing well, but we're not doing well enough. I am making a case to say, look, right now, money is a challenge. The way we're spending this money is not efficient. And in fact, we might be better than the rest of the country, but there's still a whole lot more work to be done. In fact, in Ondo State, where that is has gladly agreed to host this meeting, there are 5 local governments in Ondo State that are contributing to these bad numbers in terms of maternal mortality. I'm a bit surprised with the data, because I thought at some point Ondo was implementing a very successful ABA program, and I wonder what could have gone wrong for Ondo State to contribute almost 5, Ondo and Oyo State to contribute almost 5 local governments apiece into this not so favorable data. Bottom line, more work to be done. Now, what are the things, where are the opportunities for us? I have 5 of them as I close this presentation, which is slide 23, why invest in health? So right now, I don't know what the experience is in several parts of the country, but I'm sure a lot of us will be aware now that a lot of Nigerians are beginning to get jobs remotely. They're beginning to get jobs remotely. But these jobs are high-paying jobs in technology, ICT, medicine, nursing, and a few other things. That is the way countries transition. So the chart you have there shows that a country will move from agriculture to industry, then to services. That is what makes a country competitive, services. And we're beginning to see that. However, you will not be able to benefit from services when you do not invest in the human capital. The foundation for that human capital investment starts with the amount of money you spend in health and education. I'm making this point because the way we present our case to governors, to members of the State House of Assembly, is mostly from a purely health perspective. And that needs to change. What we need to focus on now is, look, if you buy health insurance for our people will become better people because they will get better jobs, they will become more competitive, and we can become the Dubai or the Bangalore of Africa. It's as straightforward as that. And that's why I'm focusing on this particular slide. And if you go to the next slide, unfortunately I didn't have time, I would have disaggregated that. Look, the youth or young people constitute the bulk of the population in the Southwest, from Lagos, Oyo, Osun, Ekiti, Ondo. So meaning that if we do not invest in that population, then we will be missing out of what we call the demographic dividend. The foundation of that dividend starts with what you put in health and how much you put in health, of which health insurance is one of the pathways to get a demographic dividend. That's the first opportunity and perhaps the most important opportunity. The second opportunity, dear colleagues, on slide 26, is where you have, look, we have the National Health Act, which gives partners with states through the Basic Health Care Provision Fund. The Basic Health Care Provision Fund gives 1% of consolidated revenue, shares it across states. NPHCD Gateway, NHI, the State Health Insurance Gateway, that kind of partnership. Okay? The next slide shows Mr. President launching a large health sector reform program. And then you have the next slide, which shows all governors in Nigeria signing a compact with the president and the ministers of health. The implication of that, again, this is a second key message, is that a lot of states and a lot of people in the room do not seem to understand the implication of this signing. I was in the room. I don't know if you can see me. So this is not something that happened beyond me. I was there. All state governors in Nigeria were there except one who was abroad at the time. That compact, it's only in very few states that I have seen either the shares use it to say, Mr. Governor, you signed this compact with the president. That means there are certain things that we need to do as a state so that we can unlock more money. Because people are not doing that, and that money exists. The World Bank that I work for has made available $40 million to expand health insurance enrollment. There is additional monies under other DLIs that guarantees certain services. All of this under this framework of the compact, and that is only what the World Bank itself has provided. There are many, many others like that. So many policymakers within the state health insurance entities, within the SPACDs, within the State Ministry of Health, have not actually taken a step back to say, what does this compact that my governor signed, what does it mean? And in summary, the National Health Act, which is set up in a law, and the swap compact, which is not a law but an MOU, both are the foundations of this reform. But I see, whilst it presents an opportunity, not many of us are beginning to take advantage of it. And if you go to the next slide, I had mentioned earlier that states are now making so much revenues, and I want you to compare. I don't know if you can see the slide. I can't see the slide from where I am, but you can begin to see that compared to the 12 months of 2023 to the 12 months of 2024, the amount of revenues that states earned moved from 7 trillion to 13 trillion. That is allocated through FAC, translating from 3% of GDP to 5% of GDP. No state now can say that it is owing anything. This is even increasing. 3 subsidies were removed. So there's so much money in the treasury now that any state should be able to say, look, I'm able to cover X number of people in my state, which is where I will land. The next opportunity, we will not go through that, which has to do with raising revenues through the new tax regime, because we don't have time for that. So I will just leave that. I would like to close with slide 34, which is, I think, where the greatest opportunity lies. Slide 34, 35. Nigeria has perhaps what is known as one of the largest national social registry in the world today. That was the first slide in this presentation. We will close with it. We'll go back to that slide. That social registry has 20 million households in it. 20 million. The average number of people in a household is 4.2. So you can say 20 million households times 4 gives you 80 million Nigerians. So in other words, there's a digital database that knows where and who 80 million Nigerians are. But we've had several exchanges with many people who work in state health insurance, and people do not necessarily use the National Social Registry. Just to mention that the National Social Registry, there's nothing called National Social Registry. They are all state social registry. So meaning that the state social registry is owned by the state government. In fact, the SOCU is in the office of the state governor. And if you go to slide 36, this is the old slide, but it shows the total number of people per state that are in that state social registry. Why am I emphasizing state social registry? And I would like Dawn Commission to very quickly interrogate the state social registry. Do a calculation of how many citizens in the state social registry are in the Southwest. You will get the number. I'm showing you those numbers now. Multiply those numbers with whatever you call the health insurance premium. I am telling you that with our calculation, with the money that states are earning today, the Southwest can actually pay 100% of all of its citizens that are on the state social registry. And then we can say that the Southwest has achieved universal health coverage. If I quickly look at Ondo on this list now, Ondo has, as at this time, maybe 1 million people on the social registry. 1 million people. Multiply it by whatever premium you want that Ondo State share is paying today. I can assure you that money is available in Ondo State Treasury because of what I have showed you earlier. But if you do not go to a state governor or to the state parliament with solid facts like this, then we will not make progress. Many state insurance agencies are questioning the state registry database that was developed by their state. And that's why we are not making movement. We have turned ourselves into a registration and enrollment entity. We are not. These people are our people. And by the way, this social registry actually covers more poor and vulnerable people. In fact, it is also further, if you go to the next slide, the beauty of that state social registry is that you can disaggregate according to the deciles. So if you want the poorest, so if you look at the 1 million people that is in the Ondo State Social Registry, you can further disaggregate into the level of poverty. And my argument is that if you start from the poorest and you can titrate, you say, okay, look, when I get to decile 5 or decile 6, that is what I can cover for this year. But I think it will be so transformational if I take this data for your state, take it to Governor Makinde and say, Governor Makinde, look, we have this number of people. If I go to your state data, we have almost 1 million people on the social registry. This is our premium. If you pay everything, that means your state has achieved universal health coverage. And you know each and every person because you have their database. But the approach, the current approach that we are doing one by one, it certainly will not work. And by the way, if we follow this arrangement, there's a lot of reforms that is also using this same database. Just to close, which is on the purchasing side of things, is many states, all states, have now established state health insurance entities. I am on slide 39. Many states have established state health insurance entities. But what many states are not doing is to use the state health insurance entities. And let me explain it for people who probably don't understand the principle of purchasing. So, Ondo State has general hospitals, has many hospitals. The reason why you have established Ondo State Health Insurance Entity is so that you channel your financing through that purchasing entity, which is the health insurance entity. It is that health insurance entity that now buys care for the state government. Whether they are enrolled or not is a different matter. And that is why you have certain countries that, despite their low levels of spending on health, they have been able to achieve efficiency and improved health outcomes. Today, most general hospitals in Lagos State, in Oyo State, in Ondo State, they are not receiving 100% of their money through the Health Insurance Authority. And you then ask, why did they set it up? This argument is on both sides, because the Health Insurance Authority is spending more time doing enrollment and registration when it is more primarily a purchasing entity. And that's when you now begin to see the efficiency that will come from the general hospitals, the state hospitals, because now for all the services that they are delivering, they get fully reimbursed and somebody is questioning their quality. So I think everybody here has a role to play. You have the state executive and parliament who need to allocate more money. You also have policy makers within the Ministry of Health and all of the implementing entities who also need to begin to step up to say, well, this was why you established us, so that we can buy care for you to get improved care for our people. The last slide is just simply that slide 44. That's my last slide. My last slide is saying, look, all of these things can happen with a flick of the switch. Why? This is simply because with digital adoption now, everything could be seamless. It doesn't have to be difficult. Either the state is saying, look, yes, I know I have 1 million people. I know them. I can see them because I have a digital database. Based on that, I'm transferring to you, state health insurance, the exact money for this. Those that you are transferring money to, the minute they register, you have them in your digital database. So pretty much everything is traceable, including all the way to the provider that has delivered care. So this cannot happen without digital adoption. So I finished the presentation, but I wanted you to go to slide number 2 of this presentation. Slide number 2, which just shows the population of Nigeria, the total number of households. So just to close, I've said this in the course of this presentation. Right now, we have almost 20 million households registered across Nigeria, which means that there are 80 million Nigerians that we know. And because that registration started with the poor and vulnerable, it has more poor and vulnerable people who cannot pay health insurance premium. And that, in my view, ladies and gentlemen, presents an opportunity for us to mobilize revenue to pay for their premium. When you do that, you will become one of the largest health insurance entities on the continent. So the opportunity, I think, is there. The financing is there. The economic rationale, I think, is strong. So let me pass back to you, Biodun and Mayowa. I'm not, as I said, I can't see the presentation, but I do hope you were able to connect the slides with the audience and what I was saying. Back to you.
Please let's put our hands together for Dr. Okunola from World Bank. Although he's not here with us physically, but he has done wonderfully well in that presentation. Thank you very much, sir. We appreciate you. Ladies and gentlemen, before we take the next presentation from UNICEF.
Hello?
Before we take the next presentation from UNICEF, so that after the second presentation, we'll take the comments and feedbacks together. So, but before then, let me recognize the presence of the chairman, Nigerian Medical Association Ondo State, Dr. Lumiwa Alunge. Dr. Alunge, you're welcome, sir. Thank you. I also want to recognize my brother and friend, the director from the Ministry of Health, Dr. Ayodele Adeosi. Doctor, you're welcome, sir. Thank you very much. At this juncture, ladies and gentlemen, we take the second presentation from UNICEF, and it will be made by Muhammad Okorie, Program and Social Policy Manager, UNICEF. Please let's put our hands together for him as he takes the floor. Okorie Muhammad.
Should I go to?
Thank you very much. Good afternoon, everyone. Please permit me to stand on the existing protocol. The representative of the governor, sir, Your Excellency. Okay, so for me, first of all, let me say congratulations to Ondo State. Yesterday, I was at your press briefing, so I had already seen the wonderful work you're doing, which I know you've not had time to talk about today. So congratulations to Ondo State. I am also aware of what some of the other states are doing as well, or your Lagos and other states, because UNICEF Lagos Field Office covers all the whole Southwest states. So somehow we have the opportunity of seeing what you're doing, and in some instances also supporting from behind. So, first and foremost, I really want to say a big congratulations to all the states. And Down Commission for actually convening this meeting where it brings together all the states to share lessons, because one of the key things UNICEF does right now, especially with dwindling resources, is to make sure that we intensify South-South learning, as we call it. When we say South-South here, we're not referring to South-South part of Nigeria, but this idea where at regional level you meet to learn and share experiences, that's one of the things we appreciate. So to Down Commission, thank you very much for organizing this. We learn, and one of the things I will also tell you is that from the good examples we're learning from you, don't be surprised when we send other states where UNICEF supports to come and learn from you. Because just like I was speaking to the press right now, I said that what you've started, I'm seeing today, I haven't seen it in any other part of the country where we work. So for me, I think Southwest has actually gone ahead of others in terms of how you want to approach insurance programs. It's so novel to start thinking of, if I'm registered in Ondo and I find myself in Oyo, that I should be able to access care. So it means that in terms of health coverage, you are beating both financial barriers and you're also beating geographical barriers. And I think that's the great thing to do. For us here, and I really, really want to say a very big thank you to Dr. Akiola, who has presented from World Bank. He has touched on everything I actually wanted to say. But one thing I'm really interested in as UNICEF, when we talk about UNICEF, we're talking about women and children. So I only just wanted to specifically talk about women and children only. Every other thing he has said, he has covered them. But for us, how do we reach children wherever they are? And how do we cover them? Where do you find children? So my first slide, you can see it over there. It shows the life cycle and shows for us that when you talk about child or spending on a child, you're actually talking about a child before the child is actually born. And what happens to the child and the ability to realize the rights of the child across board from that infancy to adulthood starts from the care you provide. And that's why women come into play. So for us, you can look at all of these. And the first right we're seeing here is that right to health, which is pretty much covered. So let's move to the next slide. This is the basis why we are here, especially UNICEF, is that the United Nations Convention on the Rights of the Child has said every state has to spend to the maximum of its resources to support the achievement of the right of the child. So because of time, I'm not going to take time on this. We'll go specifically to where we begin to really address some of these issues around children. So let's move quickly. So looking at the situation of women and children, you might want to tell me that the information we have from MIX, which doctor from World Bank has also spoken about, that is since 2021. But more than 80% of those who are here are from the health sector. So the NDHS report came out recently. But the truth of the matter is that in some states and in some thematic areas, the results are worse than what it was in the mix, for those who have seen it. There are some improvement in some areas, but some areas there's also not so much improvement. So I will just present some of these situations, which we'll just flip over them just to remind us. Please, so you can see slightly improvement in everywhere, but the truth is health still remains a challenge. So let's flip through all of this quickly so we'll get into the conversations. Health indicators, let's just move. I'm sure you can see them as this, and the presentation is going to be made available. Then let's move. My question really we are going to see, because most of these have to do with indicators that refer to children. But what's the reason, or one of the major reasons why these indicators are bad? The truth is financing. Financing is one of the reasons, because you know that when you are not able to finance, or when we use the term you use, catastrophic health expenditure, that on its own brings us to another topic, which is under social protection, and takes us back to the SDGs, no poverty. Because health expenditure is one of those factors that really take a lot of people out of back to poverty. So we did some analysis here. You will see in some instances where Lagos is the best, Ondo is the best. This is not about calling out. This is actually making you to realize in clear terms where you are at in your states, and to see what you can do effectively to be able to address some of these issues. Child mortality, you can see. So here, which of the states is the highest, which is the lowest? Ondo, I'm sure Ondo, with the effectiveness of your health insurance right now, a lot would have improved, from when this data was collected. So let's move to the next. Good. What could be the reason for this situation? Answer: financial barriers. Like I said before this point, I said geographical barriers and so many other barriers. But let's look at this. That's why we bring health insurance. And for me, I'm going to be looking at these issues and how they affect children. Financial protection. How many households? If you look at the multidimensional poverty index that was released recently, that places Nigeria, over 100 million Nigerians, below the poverty line, you will say that poverty is really rife. So if we're talking about accessing care, the financial protection is not there, except for those places where we have insurance operational. And I'm going to show you a slide quickly on how we are faring, at least as at the mixed time, where we are at different states when it comes to insurance cover for women and children. So coverage, benefits, premium payments, risk pooling. This coverage and the benefits, they are very important, and we're going to be talking about them shortly. So let's move. So health insurance, for us, we consider it as a social protection. It's not just a health intervention. These are some of those rights that we all have as individuals across the life cycle to get covered. So what's social protection? Some of the states here, I know Ondo for sure has started the process of domesticating the national health social protection policy. This is what it means. Social protection is a mix of policies and programs designed for individuals and households throughout the life cycle to prevent or reduce poverty and socioeconomic shocks by promoting and enhancing livelihood and a life of dignity. This is it. Lagos State has a health insurance policy as we speak. Oyo State has health insurance policy. Osun State has health insurance policy. Ondo State, do you have health insurance? Do you have a social protection policy? Ondo State. Ekiti State, does Ekiti State have social protection policy? Not yet. Which other state here doesn't have? Ogun State, not yet. We started the process, but right now we don't have social protection policy. Now, if you look at all of these, you will see where insurance comes. You will say that social security is contributive. It means there are other some forms of social protection that is free assistance. All you need to benefit from this is just the fact that you are poor. But when it comes to insurance, insurance actually is supposed to be contributory. But the point is, at some point, even when you are not contributing, someone is contributing on your behalf. I think we take it from that point. And that's why when Ondo State was speaking yesterday, Ondo emphasized so much, and I listened very attentively, to how many people they've been able to bring on board who did not contribute a penny. I think that was one of the things I heard. One other thing I picked from what Ondo is doing, and I'm speaking about Ondo because Ondo is hosting. Meanwhile, I live in Lagos, and that's where the Lashma is there, and we work very closely as well. And I'm like almost every other day I'm in Oyo State, so I also know exactly what's going on there. But one thing I see here is money-wise. Ondo said money-wise. What's the next thing for your... this? Naira-wise, head smart. Now, this comes very handy here, and we need to preach that. I love that. Naira-wise. You have to contribute. The truth is, people have to pay for their health. Okay? But we know we are at different levels. And let me give you a practical example. Before the social protection policy was approved in Lagos, the day we went to ESCO to defend that policy, one of the things that we heard is, because what we put in the policy is provide free health care to children, and then we gave different groups. What the Commissioner for Health said at that meeting was, look, don't say provide free health care, rather say provide free insurance cover. So that it comes out clearly that, look, somebody is paying for you. It's not free. And you mustn't think that it is free. It's actually not free, but someone is paying for you. And who is that somebody? It's government. In some instances, it could be the development partners. At other instances, it could be philanthropists. At other instances, it could also be private sector, as the case may be. So that's why you see that when it comes to insurance, it is contributory. People take action, but we are aware that not everyone can pay. Or rather, that the different levels of capitation people can pay can be different. And all those goes to the design and so on. So let's move. Now, this is important, really. We've established the fact that it's very important for us to have functional health insurance systems in our states, at different states. But as at the time Mix 2021 was released, can we all see, who can see which states? You can see your states, and you can see the level of coverage. You can see the percentages of coverages here. Health insurance coverage is lowest in Ekiti. I want to say, as at that time, where is Ekiti State? Is it better now? I want to believe, yes. As at that time, based on the report, which I didn't do, NBS, your State Bureau of Statistics, and others were all part of it. What they were showing us at that time was that about 99.9% of men in the Ekiti State, and we are not covered of any form of insurance as at then. Some of this would have changed. But we just brought this to tell us that, look, we cannot deny the fact that we need health insurance. But how much? What percentages? And it still shocks me. I really don't understand the rationale. We'll look at it shortly. Why insurance is there, like in the case of Ondo State I listened yesterday, you want to enroll more 1 million people. Is it that we're not seeing the people to enroll, or they don't want to be enrolled, or what? These are the key technical questions we should be asking. Especially if it's covered under the equity fund, where you really don't have to contribute, like he's saying, someone is paying for you. And we're looking for 1 million people to be enrolled, to be safeguarded from catastrophic health expenditure, which can actually drive people into poverty. What's really going on? I think these are some of the real questions we should be asking ourselves here. If those funds are there and they are available, where's the problem? Are we actually not getting in touch with those who know where they are? Or people are resistant because of quality of care, or what? Some of those questions, I know DG, sir, with the essay to the governor, you did justice to the question to the media yesterday, but I think these are some of the things we actually need to talk about here in this conference, so that others will learn from there and will begin to see how we can get these things done. All right, so let's move to the next. Now, these are some of the challenges. Affordability. I really don't want to say that affordability here, that because in some instances we have that premium. Government has put aside the equity fund to address those who are not able to pay. But for others, especially when we look at the formal sectors, look at the informal, we're talking about community-based health insurance scheme, and then we're talking about small fragments of people that we really, really want to bring into the fold without having to pay anything. So affordability could be an issue. But one thing I'm seeing here is really the limited awareness. How many people are aware of this? And how is it explained to them? Because I'm sure for a lot of people, because we need to start thinking about innovative ways of really getting these things done. If people could recharge their phones like every other day, and people are now thinking that, oh, if I pay 6,000 naira upfront, that I'll be able to adjust healthcare services. Meanwhile, the 6,000 naira is not benchmarked anywhere. This is just an example, and all other things. Then we begin to ask several questions. And is it that some people have already given up that the service packages that are given, that maybe it doesn't cover what I need? Especially those who suffer from some chronic illnesses. Yeah, I saw from the Ondo example yesterday, and pardon me, I'm just using this as example because they had a press conference yesterday, so it's really very fresh. Where they paid for MRI, for CT scans and all of that. Are these the service package, or are these specific examples? I know, yes, the other time I went to one of the states, and somebody had cancer, and the state government supported. So is that support from the generosity of the heart of the governor, or is it part of a package that people should be entitled? Because there are two things here, really. Predictability of access is one of those things that actually give us the peace of mind. Because other than that, you can actually beg from family members, relatives, or even go to the street to beg. But the fact is, when you know that this is a right and not just a privilege, then it begins to make more sense. So what packages do we have on ground, and how are we financing them, and how are we making people to know, and how are we addressing the demand and the supply sides to all of these? I think these are the real critical questions. Then the supply side, of course, the health facilities, and so on and so forth, the cultural and gender barriers, they're all part of it, which I'm sure we're going to discuss, because we are all experts in this, and you must have been dealing with this. But we really need to begin to address these issues, because one thing I'm still wondering is, why will we have these services and people are not utilizing them? So we must begin to ask ourselves those real questions that we are not yet ready to ask. Let's go to the next. Now, looking at children, for example, and I'm really interested in learning from all the states that are here. When it comes to a child, these are some of the places we find children. Of course, you find children within households. But we also know that beyond households, there are a lot of orphanage homes different everywhere. Children are there. So if you're targeting households, do we target those people there? Do we actually think about them? Do we go there? And if we're enrolling them, under what platforms? Because some of those places, they cannot come under the formal health insurance cover. Neither will they come under maybe the informal or the community-based health insurance schemes. So who takes care of them? The equity fund. Do we see them those places? Schools, how many schools are covered? I know last year that Oyo State, was it last year or this year? Oyo State did something novel. Oyo State actually registered children in schools. They paid for children in school. So children in school had cover, health insurance cover. Beyond, of course, if you went to school, I went to school. Let me pretend to be among those who went to school those days. We have school clinics. But the school clinics, basically what they could do is just stay there, maybe take paracetamol, and that's all. Because no one wants to be held liable. The chairman, Nigerian Medical Association, you know what we're talking about. In fact, those are the most sensitive places actually to be, especially if it's the highbrow schools. The parents will tell you, look, when my child is sick and has malaria, I don't give the person paracetamol. I actually give this or that. So the nurses that man them, where they are nurses, they are very, very careful. So what kind of insurance exists for them? Those are some of the things we need to ask. Beyond the schools, there are a lot of children in schools. How do you target them? Do you target them under the households? Or where do you get them? Those are key questions we need to ask ourselves. Then you have children also who are in correctional facilities. How are they covered? Because remember, it is the right of the child. It's not a privilege, it's a right. And if we must meet the rights of the children, we must find them wherever they are. Are we constrained by geographical distance, how to reach areas, or even when they are there? So these are critical questions we must begin to ask before we begin to think about universal coverage. Because the whole essence is universal coverage, meaning there should be no barrier. Now, these are some of the areas where you find children. Now, the other children who are even in workplaces. Some children in farm settlements working. So, do we find children here? And if we don't find children, it means we're not yet identifying and enrolling them adequately. So we need to begin to think beyond the formal insurance setup that we know, where we go target households, and then if I, as Muhammad, register, I pay my capitation, it covers myself, my wife, and then maybe 4 children, and I can pay for hire. But for some of those, how do we target them? So I think targeting becomes more critical, especially when we talk about the most vulnerable, talking about children now, or women from the poorest households. Then, the question that we just heard from the doctor from the World Bank. Let's go to the next slide. We are all aware for most of the states. And that's why I also tried as much as possible to link health insurance with social protection. Means reaching the people. And like he said, I can't emphasize more than what he has just said, but one thing we need to know is this. Government in its wisdom, and I can tell you for sure right now as we speak, one of the things that the SOCUs in the states, States Operation Coordination Units in the states are doing right now, those in Lagos, you know that because Mrs. Adedeji will trouble your life all the time to mine from them. That's for sure. And even as we speak, I'm sure she's almost in your office or any other place meeting with Dr. Zamba. So one thing they've done is the time has gone where you target the poor based on assumptions. Now you target the poor because you know where they are, who they are, where they live, even the geo-coordinates of their houses. And you have their phone numbers. In fact, as we speak right now, one of the things that is happening with this single social register is that they're actually trying to integrate their NIN and account numbers into the register. Meaning that if you want to target, just like he said, all the children, child-headed households, they are all there. The question is this comprehensive? Some states are different levels of coverage. There are some states where you get 30% coverage in terms of the single social register. Some states are almost 100% and so on and so on. So how do we improve upon them? But where the single social register is there, and you've not mined data from them to be able to reach the number of women and children, and in fact the entire population, who are considered poor and vulnerable based on accepted parameters set by the state and the federal government, if you've not reached them, then how is our targeting? How are we still looking for more? All you simply need to do, go to that register and then find out who are in this register. Put all of them there first, and then you can see how much you begin to achieve. And there is this direct correlation between our actions and what we see in the databases. By the time you do that, only those in the social register alone, yes, I'm aware that the processes for mix is ongoing. Starting from Friday, there is a training on mix that will be happening in Abuja, so another mix is going to be conducted. So my belief, and I believe that's also yours, is that by the time the figures come out next time, it's going to be different from this. But it can only be different based on the actions we take. Okay, so if we are not very comfortable with the single social register, what other alternatives do you have? Go to the street and start asking questions? Or based on referrals, or based on what? I think for me, I think this our gathering should actually be able to look at and address the issues of the single social register, the gaps in it, and the reason why we are not mining from it. And I think it's something else that Dawn Commission, please, let's follow up on this and see how much there's this integration, how much the data that is generated in our state is representative of true situation of poverty and vulnerability in our state. I think it begins to help us. All right, so what do UNICEF do? Generally, you know. We support both the demand and the supply side. One of the key things I want to point out that we do as UNICEF is actually our support to primary healthcare system strengthening. Because there has to be a point where you buy the services. Even when someone pays to you, services have to be available of high standard. As much as possible, there has to be 24-hour services, even if not in every ward. But with a strong referral systems, with what you are also proposing, there has to be something working somewhere for somebody to benefit. So UNICEF, on that note, yes, our colleagues in Abuja, they're also part of the Basic Healthcare Provision Fund support. The other thing we do, just like I did when I started, was to provide evidence on who is not achieving, whose child is not, whose right is not being met. That's why we're interested in mix. We're interested in all the poverty indicators. By the way, in the next few days, the Nigerian Living Standard Survey report is going to be out. So, and that's where the monetary poverty level is also going to come out very soon. So soon, you will be knowing by states which state is poorest in terms of monetary poverty. And then other results will come out once the mix that we are planning now comes out. So those are areas where UNICEF also plays a role, is that we must continue to support evidence generation so you actually know where those people are, and then you can target them and then do the other benefit packages. Capacity building, that's one of the things we do in most of our states across board. Then community engagement, I think this is also critical. There are a whole lot of things we do, and I think it's really important that with every opportunity we have, as UNICEF, as government, as civil society organization, as youth groups, whoever, we must carry this message. I know the different health insurance agencies here. You are doing a whole lot, to reach the people, but I think this is a collective responsibility, and I'm expecting that the media houses here will be able to take these messages forward. People need to know that the solution to their health problems are actually available. And the solutions are actually naira-wise. People need to know. Because people are afraid, how can I buy an insurance? I will just walk into a health facility and get. People are actually scared and thinking that they cannot achieve it. So we need to make it out very clearly. The media, the civil society, whoever, we need to say that, look, it is possible and it is naira-wise and it is health smart. Yeah, I'm sure after this, I'm going to get maybe a parcel of land to build my house in Ondo State because I'm already getting used to all you say. Then, of course, there are incentives. There's those places where UNICEF also, especially in some of those humanitarian contexts where UNICEF also provides some incentives, for states to design their own and then cover some certain groups. Those are the kind of things we also did in Oyo State, to say, look, we can actually cover children. And out of these, let's cover for this, and then let's see. If there's a good return on investment, then we can do that. But the other thing we will talk about is how sustainable will it be? We need to talk about that. So rounding off, for the Southwest states, these are recommendations. We subsidize the vulnerable group. Fortunately, I really want to know which of the states, the 6 states, is not receiving, I don't want to say cash backing now, receiving cash backing for the equity fund from the state. The state component, the basic healthcare provision fund, which we are getting. But the point is, whatever is coming from that is not adequate. Which state is not budgeting for this right now? Any of the states? That the states, well, don't worry, the media houses have left. So you can just talk about this. Because I'm sure if you say your state is not giving that fund, you go and explain. But fortunately, no one is capturing this, and exactly. And by the way, I'm also not using the microphone. But I just want to believe. This one is mute the mic. Which state is not funding it? Don't tell me it's yours, but just know. Because one of the things we need to really know is these things have to be financed. That is the truth. It has to be financed. And the truth is, sometimes it's cheaper. I work on social protection. And I know sometimes that we also do these cash transfers and all of those. A lot of cash transfers going on right now, that from the federal government, the subsidy removal, the subsidy this. These are some of the conversations we may begin to have at some point, that rather than give a cash transfer of 10,000 naira, for example, to a household, can we use that 10,000 naira to pay for health insurance cover for that family? Believe me, there's going to be more return on investment from that 10,000 used on health insurance for the family than giving the cash to the family and they spend it on just buying something once. So these are some innovative ideas we might begin to think. There are a lot of cash transfers going on. Sometimes we say, we want to do this, we want to do that. Can you actually convert it and say, we want to do this, but what we can do is, in more tangible forms, you can say, okay, I can't cover the whole population, but let's say for all children in this, I'm paying for their capitation. You don't know how much you've saved families, the peace of mind and all of that. Then, use community platforms, we've talked about it, integrated funding, pool the donor funds and all of those. When we talk about swap, swap might be talking about the general distance, but even when it comes to even health insurance as well, pulling those resources together, to achieve greater mileage is important. The next one has to really talk about the review benefit packages. Everyone of here within the health sector knows about the first 1,000 days of life and its importance. What components of those packages within that first 1,000 days can actually be included? Because if we miss that opportunity of the first 1,000 days, the effects are not reversible. So if we talk about packages, we need to begin to look at it from the child lens as well. So this is really critical for us to look at. Then, of course, performance-based purchasing. Ondo, there was a time then, World Bank, I wasn't even with UNICEF then, where we did this performance-based financing training in Enugu. And I know Ondo, for example, was one of those states that participated actively, Lagos and all the Southwest states. Then simplify the enrollment process. This is innovative. I think we can talk about it. There are ways, now POS is everywhere, mobile this is everywhere. So I think it's something that we really can do, and I believe a lot of states are doing that. Then final slide here. So we must invest. And here, I'm actually just re-echoing what your governor said. Because the speech of the governor this morning was actually very, very comprehensive and very moving with very key call to action. We must invest in equitable health financing to reduce maternal and child deaths. Of course, when I talk about maternal and child, you know where I'm coming from. But for you, you must be talking about the total population. That is it. You must, in your capacities. Then health insurance will only work for the poor if we deliberately design it that way and target them. We must design it and target them. Because even that fear, you must remove that fear. You must use the right words to encourage them to come, and then you must make deliberate efforts to find them wherever they are. The opportunity is now, with Basic Health Provision Fund, with the state laws, which has established different agencies and partners that are supporting. I think that opportunity is right now. We can actually make a difference. And let's act to ensure no woman or child, of course, adults and men, is left behind. But for UNICEF, let me stop at no woman and child is left behind. Thank you very much.
Mohammad Okorie, Program and Social Policy Manager, UNICEF. Thank you so very much. A round of applause for him, ladies and gentlemen. Thank you very much, UNICEF, for taking care of our women and our children. Thank you very much. After this, we take comments and feedbacks, right? But before then, let me recognize Chairman Private Medical Practitioners and Private Hospitals in Ondo State, Dr. Yelami Salio. You're welcome, sir. Thank you very much. We appreciate you. And I want to say that, please, those of us in the hall, we have our tags in the bags. Please, when you are exiting the hall, just use your tag to avoid any embarrassments by the security operatives at the doors there. Please use your tag when you are going out so that they will identify you. Thank you very much.
Yeah, thank you, sir. Thank you. Sorry, before the comment sessions and reactions, we actually invited the commissioners to come because we know that some of these because commissioners are part of the executives, the state executives, why the health insurance agency heads are not part of the executives. So we actually wanted some of the information to be passed to the state executives through the commissioners when they are meeting, to say that, like Dr. Okonla said, that let's even start from the social registers in our states to see how we can cover it, and then that also has been echoed by Mohammed, that's talking about the need to also look at those people that cannot afford our premium, to bring them on health insurance. And like Dr. Okonla said, which is, I'm very sure that everybody knows that because the health insurance, because they are the one paying the hospitals, they tend to monitor the hospitals better. I don't know if that's the right word to use. Better, because I know that our office is in Oyo State, in Ibadan precisely, and I know, at least from speaking from that experience, that Oyo State has actually renovated, Oyo State Health Insurance, Oyo has actually renovated many of the health centers in nook and crannies. And I am also aware that they also appointed their own doctors, aside from the state doctors, that is stationed in those places that the state government did not appoint doctors to. So it makes it that everybody, people within the local area are accessing healthcare. And that's what we wanted to use the opportunity to say, that the state commissioner for health can help make that case to the governor to use the health insurance in the agencies in the state to reach the poor. Unfortunately, most of our commissioners are not here. I think they have an appointed. Ocean was here, but maybe I will crave the indulgence of the health state governor, so that it's when we will call for another meeting, it could be virtual meeting, that we would like that advocacy to be made to the commissioners so that they can support the health insurance to get the governor's ears and begin to reduce or increase the number of release using this other platform that have been social registers that have been talked about in the states. And maybe there is a need, truly, like Mohammed said, there's a need for collaborations. I'm sure that in some states, the Ministry of Economic Planning is in charge of the social register. I don't know in other states, but so there should be a collaboration at that level. You know, see if you have the contact, the addresses of those that are on the register, then they can easily be enrolled. You know, and like Oyo State. Sorry, like I said, I live in Ibadan, so and I follow Oesha, so I know that one very much. I know that there are some other political officers, that senators, House of Rep members, and other politicians that also pay for some poor people within their area to enroll. I think that's one of the experiences that we think that will be shared today. I know that there are very innovative practices in other states, but I'm just talking about where I reside. So the floor is open. Like I said, I want to create the indulgence of the essay. Maybe when we have the meeting, you are here today to listen so that it will the commissioner, so that it's not that you are speaking in theory, you know. The practicalization of what we have been said today will be. So we'll crave your indulgence. Maybe one of those days, very soon, we'll organize a virtual meeting for that president to meet the commissioner so that they can also help us make that advocacy to the state executive. But before then, the floor is open for comments, questions, clarification. Mohammed is there, and I'm very sure that Dr. Okola also is still online. If there's any comments or contributions, thank you.
Yes, the floor is open for anyone who have any comments, contributions, or clarification. You have the floor now. Thank you. Pharmacist Babalola.
Thank you very much. I want to, Your Excellency, permit to stand on the existing protocol that has been established. I want to say that the health insurance, as in other developed countries, is the best way to take care of the health of the citizen. So I want to commend the participating states in this conference, and I want to thank their governors for supporting this laudable idea. You see, for instance, when Mr. Okonla was talking about giving his own lecture, one thing came to my mind, because some of the NGOs that have been supporting health in this country, they are disengaging. Then one idea came to me, and I thought of it that in our state, you have an education endowment fund. If you are a supplier, a contractor, you pay that as part of your development levy. I was whispering to the advisor on health that that policy can be incorporated into our system in Ondo State. If it is 1%, let every contractor, so that it will be participatory. So we can start paying that so that we can sustain this program. Then I want to point the attention of all the operators to the fact that in providing health, we must ensure that we have good medicines to provide, especially the secondary providers, and in some places, in some cases, in some states, the primary providers, so that the money, the funding will not be going down the drain if you continue to treat a particular disease with fake or counterfeit drug for some time. The patient, the patient, enrollees, will not get the appropriate treatment. It will be getting worse and it's part of economic drain. So these are some of the things I just want to commend everybody for this. Even for me, if not because of political reasons, all this cash money transfer by the federal government, they are supposed to be plowed into this kind of program so that there will be wider coverage for the citizens of the country. Thank you. Oh, sorry, my name is Pharmacist Babalola Taiwo, the chairman PSN, Ondo State.
I'm Pharmacist Musa Yegusi, the Secretary, Ondo State Drugs and Health Commodities Management Agency. Let me just commend the presenter. That was a well thought and well presented paper. But my thought is that on the heel of look at the Basic Health Provision Fund, for example, where we are 1% from the revenue of the federal government, consolidated revenue from the federal government. But I believe that that can be extended to the federation account. If we can get 1%, that means automatically the state government already contributed to it. Because you pull 1% from the federation account, then that'll be a lot of money pool that can be for that program, instead of just limiting it to the federal government account alone. I know health is exclusively, it's not just, federal government does not just regulate it, they are also being regulated by the state. But advocacy can be made for this, so that we, as a down commission, everybody that is involved can sit down and look at it, that if federal government can come, that 1% can be from the federation account, not from the federal government revenue alone. I think that would be a lot of money to run the system. And the second issue about the social register, we understand that it's a very difficult thing, because I had that experience when I was formerly in the Contributed Commission, and I wrote 2021, for example, when we went for registration, when we were using the social register, we find that social register did not speak to the reality on ground. We go to places, very remote area, and you got the register, you can't even find the person that was the register. And unfortunately, we also went on here, we advocated that we are coming, we reached out to the local government, everybody. And when we got there, they found out, they thought we want to share money. And they didn't see money, and everybody ran back. In fact, if not because of the ingenuity, that at times we recorded close to less than 20% in some places. Register, when we have about 80, we want to register about 100. So it's a lot of issue and just because of what is going on, and I think that a lot of advocacy needs to be done. And when we are going for this social register, it must speak to the reality on ground. People must be captured. The right people must be captured. And we miss it, then we might miss the program. So that's just my thought and my contribution to it. Thank you very much.
Thank you. His Excellency and all the dignitaries. My name is Dr. Oyelami Saliu, Ondo State Chairman of the Association of Nigerian Private Medical Practitioners. Well, let me start by thanking the organizers of this program This is a very important summit. I want to touch on two areas. We've all seen that in almost all the presentations, the issue of funding continues to reverberate, coming up and down, funding and funding and funding. Coming from the private sector angle, I want to say that in Ondo State, the Contributory Health Commission has been doing wonderfully well. And the effort at incorporating the private sector of Ondo State in recent time has been so commendable. And you agree with me that if you have been on Ondo State in the last 2 years, the efforts are now yielding. But beyond what we are currently doing, the issue of capitation for the private sector is always a recurring decimal. And I'm sure, as a national officer of the Association of Nigerian Private Medical Practitioners, so I know that the same thing is what is happening in almost all the states of the Federation. What can we do? The recent increase in the capitation by the NHIA is commendable, but we still have a long way to go. What else can the state commissions, agencies do for all of us so that we can move? That is the first part. We will definitely do much better when this improves, and it's going to be to everybody's advantage. But in addressing this, I have observed, and we have raised this times without number, and I remember for those some of us who were part of the recent conference by the National Health Insurance Agency, we were saying, if we look at our country today, everybody is talking. Everybody's buying data. And every day we talk, the students talk, the adults talk, the market women talk, and sometimes even myself and all of us, sometimes you load a card now, here you buy airtime, 3,000, and in 2 days you buy another one, 500, in 24 hours you buy another 3,000, and like that. Is there a way we can all look at this as Nigerians, funding health insurance? That there can be a way by which, for example, these days, those of us in the private sector, I'm aware of some hospitals now, even when you want to pay, they say your bill is, for example, 5,000 naira. And say you are paying by transfer. So you are paying to OPay. 50 naira will go out of that. Please add 55 naira, 50 naira. That's the way it's done. And that's a lot of money by the time you... Is there a way that each time you talk, even if it is just 1 naira, somehow the money goes somewhere? And this is health insurance. This is going to be a lot of money going into the coffers of the health insurance agencies, especially at the state level, which the bodies are closer to the grassroots. And then this can take care of that. How can we work this out? Are we thinking in this direction? This is a simple, easy, convenient way. You don't even know you are paying. Every time you talk, you are already paying 10 naira, or you are paying 5 naira. And imagine the number of people who talk in a single day. In Akure South alone, I can imagine how much we raise on a daily basis to finance the health of all of us. We are thinking about it. We have to be creative about it. The economic situation in the country is something else. We have also been talking about increasing poverty level. But if we look into these directions, I think we will not be as poor as we think we are. Thank you very much.
Thank you. Good afternoon, fellow participants in this program. I'm Dr. Omuyiwa Alunge, the chairman of Ondo, and I'm very excited to be here. The issue of health insurance, it's apt that we should talk about it. More so because for us to be able to give qualitative health care to the citizenry, out-of-pocket payment can no longer do it. The poverty level is very high, and for our people to be able to access care, the way to go is health insurance. And that's why I appreciate the organizers of this program. And I also thank the Contributory Health Commission for hosting this program. Having said that, I also want to say that in the last 2 years, like my colleague said, we are beginning to see the impact of this commission in the state. You are doing a very good job, and it's worthy of commendation. Well done, sirs. Please, I just want to make comments on some aspects of representation that has been made. I think it was last year that the attempt to enroll the informal sector into the scheme started in Ondo State. I don't know how far we have gone, but I think we need to begin to look at innovative ways of ensuring that we succeed in this. If everyone must be, it is universal coverage we are looking at. So if we must ensure that people are completely enrolled, then we need to look at the barriers preventing people from even, or not enabling people from to enroll into the scheme. And I think it must be research-based. Many a times we think it is maybe they don't want to put in money. Yes, that's one reason. But we might need to look at, even do few research to see what are the local factors stopping people from, wanting to access the scheme. Is it because they don't even know about it?